Hi everyone, very warm welcome to all of you guys. Very good evening to each one of you. And in now today's section, we are going to discuss the most important thing that are anticipated in your exam about psychiatry. So, what are the important questions that can be asked in your examination? We are going to focus specifically on those important factors, right? So, give me a quick confirmation whether I'm clearly audible and visible so that we can proceed with the session. Hi, Doctor. Hi, Rahul. Hi, Neet. Hi Simran. Simran, it is not going to be the substitute for the complete classes, but yes, if you have not done anything, this is going to be a session which is going to help you a lot, right? Good evening, Sunir. Good evening, Arya. Right. So now, if I'm clearly audible, visible, let's begin with the session. Okay. First of all, let's start with the positive thought. And the positive thought we are having when you want to give up, remember why you have started. Always remember why you have started. It's a last time of the examination. You are not having a lot of days, right? So just be in the pace that you are constantly doing like last 3 to 4 months. Okay. Just try to do revisions. Don't just give up. Now most of people are thinking like that we will be giving the next examination because we have not studied, but trust me, you know everything. These things are in your subconscious mind, and when you are going to give the examination, they are going to come out and you will be passing out with the flying colors. My best wishes are always with you, right? So let's begin the session with the question number one. What is the question number one that we are having in front of us? A 25-year-old male patient, a female patient is brought to the hospital. So we are having a patient, female patient. Her mother is stating that she does not feel good. She does not feel good, right? She likes to stay alone. She don't want to talk with the people, right? She don't want to talk with the people. Earlier she was very social. Earlier she was very social. When asked with the patient that she don't when we ask the patient, she tell that she don't feel pleasure in those activities which were pleasurable before. Right now, these are all the symptoms. Because of what? All of these symptoms are because of what? She's not talking to anyone. So what are the symptoms this particular patient is having? She is having symptoms of alogia. She is having symptoms of sociality. Right now she is not social, right? She is having a specific symptom. What is this symptom? That she was those activities which were previously pleasurable, she is not getting the pleasure in these activities right now. For example, earlier she used to watch movies. She feel good after watching movies. Right now she don't want to watch movies. Or maybe she's playing some games. Right now she don't enjoy it, right? So this is a feature. Very good. That is going to be anhedonia. Anhedonia. And can anyone tell me all these features are going to suggest in the terms of what? All of these are collectively what kind of symptoms? They are positive symptoms, they are negative symptoms, or what? Yes, yes, Rahul. They are going to be negative symptoms. They are going to be negative symptoms. These are going to be the negative symptoms. And negative symptoms, what do you think? What can be the diagnosis in this particular case? These can be seen in the cases of depression. These are the symptoms you will be finding in the cases of depression, or these can be negative symptoms of schizophrenia. Negative symptoms of schizophrenia, right? Very good. So there can be negative symptoms of schizophrenia. Now they want to know about the dopamine. What will happen with the dopamine? So dopamine increase or decrease in the mesolimbic or mesocortical or maybe tuberoinfundibular. We are having nigrostriatal pathway. You must be studying about a lot of things about this dopamine. Sometimes we just want to decrease the dopamine, we want to increase the dopamine. So let me make the story clear for you. So what are the different pathways we are having for the dopamine? Remember, we are having four important pathways. First one is going to give you positive symptoms. Second one is going to give you negative symptoms. Third one is concerned with the tuberoinfundibular pathway. And lastly, we are having nigrostriatal pathway. तो एक disease तुम लोगों ने पढ़ा होगा. If there is decrease in the dopamine, let me start with the nigrostriatal pathway. So if there is decrease in the dopamine in nigrostriatal pathway, which is the disease that is going to happen? Yes, your pharmacology, medicine, low dopamine in the nigrostriatal pathway. What is the disease you will be having? What is the disease you will be having? Decreased dopamine in the nigrostriatal pathway. Decrease in the dopamine in the nigrostriatal pathway, that would lead to a disease that is known as Parkinson. Very good, Hari. That is going to be your Parkinsonism. And for that Parkinsonism, what we want to increase the dopamine. So we are giving drugs like levodopa, and along with that, we are giving carbidopa. And the drug of choice will be ropinirole or pramipexole. Okay, ropinirole. So this is going to be the story of nigrostriatal pathway. Whenever we are having decrease in dopamine in nigrostriatal pathway, patient will be having Parkinson. What are the symptoms? Patient will be having rigidity. Patient will be having tremors. Patient will be taking baby steps. Okay, he will be having rigidity. He will be having tremors. Right? He will be having he will be taking small steps. Right? So that is going to be your Parkinson. Right? Now, what is going to happen if there is changes in the dopamine tuberoinfundibular pathway? Remember this tuberoinfundibular pathway, this dopamine is also known as what? This dopamine is also known as prolactin inhibitory hormone. This is also known as prolactin inhibitory hormone. And what is the function of this prolactin? The function of this prolactin, you can remember, prolactin is going to be responsible for the production of milk. So if there is more prolactin, there will be some hormones which are going to decrease the levels of prolactin. So whenever we are having more prolactin, what is going to happen? This dopamine is also known as prolactin inhibitory hormone. We will increase this dopamine, and what is going to happen? This is going to inhibit your prolactin. This is going to inhibit your prolactin. We are using in the treatment of prolactinoma. I'm just connecting the subject, right? We are using it in the cases of prolactinoma. What is going to happen in prolactinoma? There will be tumor in the pituitary gland. There will be tumor in the pituitary. So what do we want? We want to increase the dopamine. We are using two important drugs. One is your cabergoline. Second one is your bromocriptine. So these are the two other pathways that we are having. What are the symptoms that are going to happen? Prolactinoma. If there is tumor of prolactinoma or pituitary gland, what is going to happen? There will be increase in the prolactin. There will be galactoria. This person will be having galactoria. And remember, whenever a mother is feeding, she is not able to conceive, right? So this particular patient is also going to have amenorrhea. Amenorrhea will be there, right? Apart from that, this pituitary tumor is going to compress your optic chiasma. That will be leading to what? That will be leading to bitemporal hemianopia. That means patient will be having this type of vision. He will be able to look at the front things, right? Bitemporal hemianopia, right? So in this particular scenario, we are going to give what? We are going to give again this dopamine, and these are your dopamine analogs that we are having, right? You understand? Now third pathway we are having is mesolimbic pathway, and lastly we are having mesocortical pathway. So you can remember the mnemonic is NMC. Mesocortical is responsible for the negative symptoms. Mesocortical is responsible for the negative symptoms. Very good, Vicky. So glad for you. Okay, it is responsible for the negative symptoms. What are those negative symptoms? We are having negative symptoms like anhedonia. We are having symptoms like alogia. So what is going to happen whenever there is going to be decrease in the dopamine? What is going to happen in this particular pathway, in mesocortical pathway? You will be having negative symptoms. And if there is problem in the mesolimbic pathway, what is going to happen? If mesolimbic is concerned, it is related with the positive type of symptoms. What are the positive type of symptoms we are having? We are having symptoms like hallucination. We are having symptoms like illusion. So these are going to be your positive symptoms. And these are your negative symptoms, right? So negative symptoms is concerned with, you can remember, mesocortical pathway, and positive symptoms are concerned with mesolimbic pathway. Positive symptoms are concerned with mesolimbic pathway. Okay, you understand this? Now, what is the answer would you like to give in this particular case? So she is having what kind of symptoms? Can you appreciate? She is having what kind of symptoms? This particular patient is having what kind of symptoms? She is having negative symptoms or positive symptoms? These are all your negative symptoms. So what would be your answer in this particular scenario? There will be decrease in the dopamine in which pathway? In mesocortical pathway. There will be decrease in the dopamine in mesocortical pathway. Mesocortical pathway. There is some issue with the camera. Just give me a minute. Just give me a minute. I'll just correct the camera. So this is going to be your D, option number D. Just look at this particular table. You will be getting multiple questions from here, right? Just give me a moment. Right, to read the question number 2, we are having a 29-year-old female. Yes. Okay, a 29-year-old female arrived at the emergency, right? This female is coming at the emergency department with the police. She is accusing that all her neighbors are conspiring against her. Very, very characteristic thing. All her neighbors are conspiring against her and wants to harm or wants to kill her, right? There is a female, she's going to the, or she's coming to the hospital along with the police, and she's telling that all my neighbors wants to kill me or wants to harm me, right? After police investigation, they have confirmed that there's nothing like this. This is a false accusation, right? This is a false information that she is giving, but still this particular patient is having a firm and fixed belief. So what is the diagnosis? What kind of a disorder is going to explain this? What kind of a disorder is going to explain this? Yes, waiting for a response. So is it a delusion? Is it a superstition, illusion, or hallucination? What do you think? So here it is clearly written, this is a firm and fixed belief. This particular patient is having firm and fixed belief. Remember, whenever they are going to write this particular term, firm and fixed belief, which is unshakable, now they are giving the proof to this particular female, but still she is saying that still she is having a firm and fixed belief. So this is known as what? This is a delusion. This is a delusion. This is a diagnosis will be delusion. So delusion is a firm and fixed belief which is unshakable, and this is going to be your delusional disorder. This is going to be your delusional disorder. What is superstition? Superstition means there is a firm and fixed belief which is shared among people. Let's say, let me give you example. मैं बोलता हूँ, let's say I am the God. Let's say I'm telling you that I am the God. If I believe this particular thing, this is my, if I believe this particular thing and it is unshakable, that is going to be your delusion, right? But if lots of people are telling the same thing, if they are supporting me, they are coming from the same community or they are supporting me, what is going to happen? This is known as superstition. This is known as superstition. So there is going to be a delusion which is shared among the people, which is shared among a group of people or a lot of people. So this is going to be your superstition. We are having a lot of superstitions here, right? Kali billi rasta kaat gayi, right? These are all what? These are all nothing but superstition, because it is believed by a lot of people. It is believed by a lot of people. That is going to be your superstition. What are these? Hallucination and delusion. Sorry, what is this illusion and hallucination? These are going to be the disorder of perception. These are going to be the disorder of perception. Suppose this is a pencil in front of you. If I tell you that this is a guitar, let's say this is a revolver, let's say this is a revolver, this is going to be what? This is going to be illusion. That means false perception of a real object. This is a real object. If I am perceiving this particular thing falsely, that is going to be your illusion. But now if I'm telling you that this is a revolver, I will kill you, I will shoot you, now what is going to happen? This is going to be hallucination. If I can see the revolver, if I can feel the revolver, that is going to be your hallucination. So false perception of an object in the absence of an object, there is nothing like that, okay, still I am perceiving it like this, this is going to be your hallucination. You understand the difference between illusion and hallucination? Illusion matlab there is going to be some object, usko मैं falsely perceive कर रहा हूँ. Let's say this is a cable, I am perceiving it as a snake, that is going to be your illusion. But if there is nothing and still I am seeing the snake, that is going to be your hallucination, and both of them are going to be your both of them are going to be the problem with the perception, right? What is this delusion of reference? We are having delusion of reference. Delusion of reference. Let me write down some delusions for you. So delusion of reference, what the person is going to think, उसको लगेगा हर कोई मेरे बारे में बात कर रहा है. Everyone is referring me, right? Here the person will think everyone is referring to him. दो लोग बात कर रहे हैं, he will be thinking that they are talking about me, right? So this is going to be the delusion of reference. This is going to be the delusion of reference, right? Next we are having delusion of grandiosity. What is going to happen in delusion of grandiosity? Grandiosity means person will think that he is the most superior person, he is the god, right? He will think like that, he is the god, he is the superior person, right? So this particular person is having the delusion. Delusion matlab kya ho gaya? There is a firm and fixed belief. This person is going to be having the delusion, right? So this person is thinking like that, I am the god. That means he will be thinking like that throughout his life, right? So this is going to be your delusion. We are also having nihilistic delusion. We are also having nihilistic delusion or delusion of negation. This is going to be your nihilistic delusion. Here you will be having delusion of negation. Delusion of negation. हाँ, जो कुछ भी हूँ मैं ही हूँ, right? Super powers, खुद को भगवान समझना. All these things are going to be the delusion, right? Next we are having, what is illusion? Let me write it for you. Illusion is going to be false perception of real object. False perception of real object. This is going to be your some issue with the camera. This is going to be illusion. What is hallucination? Hallucination is false perception in the absence of any object. But remember this hallucination, 2-3 most important things. What are these 2-3 important things we are having? They are going to be as vivid as real. They are going to be as vivid as real. They are going to be as vivid as real. Okay, that means this particular person is looking at the things and these things is going to be like real things. These things are going to be like real things, right? Yes, they are in the absence of object. And they should be occurring in outer and objective space. That means they should be occurring in outer and objective space. ऐसा नहीं है तुम लोगों ने आंख बंद करी, you are looking at something, that is not going to be hallucination. That is not going to be hallucination. It should be present in the outer environment. That is known as hallucination, right? We can have positive symptoms, negative symptoms, we have seen about it, right? Most common type of hallucination, the question they ask you, most common type of hallucination is going to be your auditory type of hallucination. Auditory type of hallucination is going to be the most common type of hallucination. Okay, most common type of hallucination in organic mental disorder patient. Organic mental disorder patient, what is going to be the most important type of hallucination? That is going to be your organic mental disorder, or if there is any damage in parenchyma, damage in brain parenchyma, that is going to be your visual hallucination. Visual hallucination. So those patients who are going to have damage in the parenchyma, damage in the brain, these people are going to have more commonly visual type of hallucination, visual type of hallucination, right? Read the next question. Next question, we are having a 27-year-old boy brought to the OPD by his family with complaints of hallucination for last 2 months after the breakup with his girlfriend. This person is having a breakup with his girlfriend, and the boy refers that he is hearing the voices talking about him. He's hearing the voices talking about him and commenting on his actions. So what is this particular thing? Try to answer. The boy also stated that he feels like someone is inserting these thoughts in his mind, and with some technology. What is the probable diagnosis in this particular case? So try to answer this one. What do you think? What can be the answer? Yes. C. Some are telling me B, some are telling me C. So let me teach you how you can understand this, right? Whenever we are having voices word, whenever we are having the voices word, this voices are going to be referring to the third person. They are going to refer to the third person. They are going to refer to the third person, and this is going to be your auditory type of hallucination. First thing, this person is hearing something. He's hearing the voices talking about him. So this is going to be auditory type of hallucination. Auditory type of hallucination, right? Second thing, commenting on his actions, like I'm just moving the hand and now I'm looking at the screen. This type of action, whatever this particular person is doing, he is hearing those voices. Now he has started walking, now he's drinking water, now he's scrolling through phone, right? All the actions that this particular person is doing, these actions he can hear from those voices. This is known as running commentary. This is known as रनिंग कमेंट्री. इसको क्या बोलेंगे? रनिंग कमेंट्री. So this particular person is having running commentary, and lastly this particular person is having what? He is having someone is inserting the thoughts into his mind. So this is going to be what? This is going to be your thought insertion. This is going to be your thought insertion, right? So these are the things we are having, and the diagnosis that you will be making over here is going to be schizophrenia. But what kind of schizophrenia, how you will differentiate between schizophreniform disorders, brief psychotic disorder, acute psychotic disorder? So there will be the most important thing, and the most important thing is the timeline that we are having. So this particular thing is happening from last 2 months after his breakup. This particular thing is happening after his breakup from the last 2 months, right? So what is the timeline that we are having? We are making a diagnosis of schizophrenia if it is more than 6 months, if the symptoms are persisting more than 6 months. For the schizophreniform disorder, the timeline will be 1 to 6 months. The timeline will be 1 to 6 months, right? And for brief and acute psychotic disorder, the timeline will be less than 1 month. If the timeline will be less than 1 month, right? So now tell me your answer. What do you think? Yes, Mohammed, Rahul, Fateha, Hari, Arya, Anuj, Medico. Yes, what do you think now? What is going to be your answer? This is going to be what? Is it a or B or C or D? What do you think? The timeline is already given. It is 2 months. So answer will be here. In this particular case will be schizophreniform disorder. This is going to be your schizophreniform disorder, right? Is that okay? Yes, very good. Okay, now we are going to discuss how to make the diagnosis of that schizophrenia and basics of psychiatry. Very, very important. Apart from that, the question they are asking from psychopharmacotherapy, right? These are the important parts in this particular psychiatry. We are having mood disorders and schizophrenia. Very, very important, right? So we are having these symptoms. These are your 11 SFRS symptoms. These are going to be your 11 SFRS symptoms. Apart from this, these are your 4 A's, and these A's were given by Eugene Bleuler. Eugene Bleuler. And this is the particular person who has given the term schizophrenia. He has given the term schizophrenia. And remember, one more question they have asked. The term psychiatry was given by the father, that is going to be your Christian Johann Rell. Christian Johann Rell. He has given the term psychiatry. He has given the term psychiatry. Okay, these are the 4 A's of Bleuler. These are the 4 A's of Bleuler. He has given, that is going to be 4 A's. First one is your affective disturbance. Affect means affect and mood are the one or more. Basically, they are going to deal with the emotions, right? Affect मतलब क्या होगा? These are going to be emotions. Affect is going to be at a cross sectional point of time. Affect is going to be at a cross sectional point of time, whereas mood, we call it as mood खराब है. Mood is not okay, I'm not in a mood. So that is going to be a longitudinal thing, that is going to be staying for hours to weeks maybe, or like just it is going to be a long term thing, whereas affect is going to be a cross sectional at particular point of time. What is the affect, what is the emotions, what are the emotions, that is going to be your affect. तो दोनों में क्या डिफरेंस है? affect cross sectional point of time यानी अभी क्या है, right? and mood is going to be, mood काफी टाइम से खराब है, mood नहीं ठीक रहता, that is going to be a longitudinal thing, that is going to be your longitudinal thing, right? So affect, it can be inappropriate, it can be blunted, it can be flattened. We are having second thing, second thing is going to be your autistic thinking, right? Third thing is going to be loosening in the associativeness, right? There will be associative looseness. And lastly, we are having ambivalence. This person is not able to decide things. These are the 4A of Eugene Bleuler. Now we are going to discuss about the 11 symptoms of SFRS. 11 SFRS symptoms we are having. Schneiderian first rank symptoms. These are your 11 symptoms. So if someone is having thoughts, someone is hearing the thoughts, audible thoughts will be there. There can be voices arguing about. Third, voices arguing about is what? Voices means auditory hallucination. So some people are talking about it, right? Voices commenting, like I've told you about the running commentary, right? What is this? Somatic passivity. This person, somatic passivity means this person is feeling like its body is under the control of something. Someone is controlling the body. Someone is controlling the body. That is going to be your somatic passivity. Thought withdrawal, these are going to be your three thought things. This is going to be your thought withdrawal, thought insertion, and thought broadcast. Matlab thought is going away. Lot of people can hear this, right? Thought insertion, someone is trying to put certain thoughts into his mind. This type of symptoms you will be getting in the schizophrenia. Lastly, we are having some med effects, med impulse, and med violation, right? This particular person will be feeling like he is under someone else's control. He will try to put his hand into the fan. और जब उसको पूछोगे, he will be telling you that मैं नहीं कर रहा, someone is trying making me do this, right? So that is going to be some external force. Some external force is going to control him. He will be telling you like that, some external force is controlling me, right? And lastly, we are having delusional perception. Most common type of delusion is going to be your delusion of, what is that? Most common type of delusion is delusion of persecution. Delusion of persecution that we have seen in this particular question. Here this particular patient is having what? This particular patient is having delusion of persecution. मतलब कोई मुझे harm करना चाहता है, मतलब कोई मुझे मारना चाहता है. Someone is trying to harm me, someone is trying to kill me. That is going to be your delusion of persecution, and that is the most common type of delusion. Most common type of delusion, right? So this particular case, these are the 11 SFRS symptoms. These are going to be the 4 A's of Eugene Bleuler, right? These are the important things you should be remembering, right? So these are going to be your auditory type of hallucination. Auditory hallucination we are having, where we can hear the thoughts from the voices talking. Voices can comment, running commentary, right? We can have somatic passivity, that means someone is trying to control the body, right? Thought insertions, thought withdrawal, thought broadcast, med impulse, med effect, med violation, and lastly we are having delusional perception. These are the symptoms on the basis of which we are going to make the diagnosis of schizophrenia, right? Next question we are having in the list: a 28-year-old male patient presented to OPD. This patient is coming to the OPD and the clinician has asked the patient, where do you work? The doctor is asking the patient, where do you work? The patient replied, India is a beautiful country. Modi ji is the prime minister and I have a beautiful girlfriend and we work together. But this particular person did not tell the answer to the question, what kind of formal disorder this particular patient is having, right? Try to answer what is this particular patient is having. So whenever you are asking the patient that any question you are asking, but still the patient is telling you all the information here and there, but still he is not giving you the answer. This is what happens with us when examiner asks the question, सारा बता देंगे exam में, exam answer नहीं बताएंगे because we don't know the answer, right? So this is what is happening in the patients, and this is going to be what? Is it a tangentiality? Is it a circumstantiality? Is it a incoherence or loosening of association? What do you think? What is this? Tangentiality? Yes. Look here, circumstantiality means you can remember the circle, right? ये सारी बातें घुमा फिरा के ये आंसर पे आएगा. This person is going to give the answer. Here the answer will be given. Here the answer will be given by this person. This is going to be circumstantiality. Tangent, you have studied about tangents in the mathematics. So circle के पास से जो निकल जाता है, that is going to be your tangent, right? So tangent, it is not going to this particular person is not going to give the answer. No answer is given. It will go around the answer, but no answer is given. This is simple thing you can remember. अगर answer दे दिया, that is going to be your circumstantiality. घुमा फिरा के answer दे दिया, 10 चीज़ें बता दी, मैं यहाँ रहता हूँ, वहाँ रहता हूँ, but still he has given the answer कि I am working in a this particular institute, I am working here and there. If this particular patient has given the answer, that is going to be your circumstantiality. यानी घुमा फिरा के answer दे दिया. But now this person has given multiple answers, like he's replied that India is a beautiful country, Modi ji is the prime minister, I'm having some girlfriend, right? But he did not tell the answer. He did not given the answer. He did not tell the answer, and this is what is the feature you are going to find with the tangentiality. You are going to find with the tangentiality. So these are going to be your thought disorder. These are going to be your disorder of the thought. Definite one question is going to come from this. Thought disorder are going to be very, very important. So I'm going to just summarize all the thought disorders for you. We are going to have 4 type of thought disorders. First thing we are going to see about the flow of thought. Flow of thought. First thing we are going to see is about the flow of thought. We can also call it stream of thought. Stream of thought. If the speed of this thought is more, if the speed of thought is more, I'm explaining, if the speed of thought is more, what is going to happen? If the speed of thought is more, we call it flight of ideas. Flight of ideas. We call it flight of ideas, right? And this is a feature which is going to be seen in the cases of mania. This is a feature we are going to see in the cases of mania. Suppose if I'm having mania, what I will be doing, I will be speaking so fast that you are not even able to understand. That means the flow of thought is very high. The flow or the stream or the speed of thought is going to be very high in the mania patient. दिमाग इतनी तेज चलेगा, he will be speaking some words but they are not going to get the right meaning. He will be speaking very fastly. So that is going to be seen in the cases of speed increase in the flight of ideas. When we are going to have decrease in the speed of thought, decrease in the speed of thought is known as inhibition. This is known as inhibition, and inhibition is a feature of depression. Here the patient will be having depression. This particular patient is going to have decrease in the speed of thought. He will be talking you very slowly. उसको जिंदगी में मजा नहीं आ रहा, right? This particular person is going to have depression, right? Next one we are going to have is the content of thought. Very, very important. Second one is the content of thought. The most important thing that you have to remember, multiple times this question has been asked. Always you cannot afford to skip this particular thing. Remember, delusion is a disorder of content of thought. Delusion is a disorder of content of thought, and I have already told you what is the most common type of delusion. If you want to remember, that is going to be delusion of persecution. Delusion of persecution, that means someone is trying to harm me, and this is a feature you will be finding generally in the cases of schizophrenia. Schizophrenia patients, right? Apart from that, next one we are having is the form of thought. Formation of thought or form of thought. Here we are going to have certain things. First one we are going to have is derailment. That means there is loosening of there will be that particular thing is going to be broken down, right? Two thoughts are going to be derailed, just like a rail is a long thing, right? Two thoughts are derailed, that is going to be your derailment. Next one we are having is loosening of association. Loosening of association, there will be no association between two thoughts. Like I am teaching psychiatry, Modi ji is the prime minister, right? That is going to be what? That is going to be the loosening of association, right? Next one we are having incoherence. Incoherence means what? That is going to be your word salad. Word salad, you can remember word salad, right? So what is going to happen in the word salad? Whatever things it is coming in mind, he will be telling, but it is not going to convey any meaning, right? That is going to be the word salad, right? जो भी आ रहा है मन में बोले जा रहा है but उसका कोई मतलब नहीं निकल रहा है, that is going to be your incoherent, right? Next we have tangentiality. I have already explained you tangentiality. This particular person is not going to answer, right? Lastly we are having neologism. What is this neologism? Neologism is a feature you will be finding in which disease? You will be finding this particular thing in the cases of schizophrenia. Those patients who are schizophrenic patient, they will coin a new term. Okay, they can call you, they can make certain new term, and this is going to be a specific feature that you will be finding in the schizophrenia patient. This is going to be find in the patients of schizophrenia, right? And lastly we are having possession of thought. Lastly we are having possession of thoughts. Possession of thoughts, we are going to have what? Here we are going to have thought insertion. Here we are going to have thought insertion, thought withdrawal, and thought broadcast. Thought insertion, thought broadcast, and thought withdrawal. These are going to be your possession of thoughts. These are going to be your possession of thoughts. Very, very important question. They always ask you, they will tell you that this particular patient is having multiple times, 7 to 8 times they have asked this question in various examination. Ultimately they want to know that the delusion is a thing which is going to come in the content of thought. This is going to come in the content of thought, right? Thought insertion means someone is trying to insert thoughts into my brain. Thought broadcast means thought withdrawal means someone is trying to withdraw the thoughts, right? And thought broadcast means this particular person will be thinking that whatever he is thinking is going to get heard by so many people. That is what is going to be your thought broadcast, right? So these are going to be the thought disorder, formal thought disorders, right? Is that okay? Now we understand what is loosening of association, circumstantiality, tangentiality, and incoherence. That is going to be your word salad, right? So your answer in this particular case will be tangentiality. Okay, this type of question I hope you will be able to solve. The next question in the list, we are having a 29-year-old girl has presented to the OPD with the complaints of regular washing of hand. Regular washing of her hand, although she knows that it is completely illogical, but still she is not able to control this type of behavior. Whenever she tries to control it, the feeling of anxiety and depressive mood and all of these things will happen, just like the anxiety things. And this is going to be, all of the following are going to be relevant for this particular disease, all except. This is your question, right? So what do you think? What is your diagnosis? So first of all, the option number A is it an ego dystonic or ego syntonic? What is the meaning of dystonic and syntonic? So let me make you understand. This particular person, she knows that this is completely illogical. Ego dystonic, completely illogical means it is a ego dystonic thing. That means this particular person knows washing hands again and again is completely illogical. She agrees with this, but it is a ego dystonic thing, right? She does not comply with this, right? Ego syntonic, on the other hand, are your personality disorders. Some people are having aggressive personality, multiple type of personality disorder. I'm going to teach you. So those things, those disorder are going to be ego syntonic. मैं जो हूँ, even if I'm a terrorist, I will be happy with myself, right? So this type of people, those people who are like bad people, those people who are having personality disorder, whatever kind of people they are still happy with themselves, because this personality disorder is a ego syntonic thing. But this particular thing is going to be ego dystonic. Ego dystonic मतलब अगर किसी को OCD है, this is the diagnosis. What is the diagnosis in this particular case? Diagnosis will be obsessive compulsive disorder. That is going to be obsessive compulsive disorder, and this obsessive compulsive disorder will be having two parts. One is your obsession and another one is your compulsion. Another one is your compulsion. So what is this obsession? So obsession is going to be constant. Remember, obsession is a constant, irrational. These type of bird, they will be giving an examination. Constant, irrational, repetitive. This particular person will be having constant, irrational, repetitive thought, right? And this thought, if this person is not going to comply with this thought, what is going to happen? It will create what? It is going to create anxiety symptoms in this particular patient. Agar wo haath nahi dhoega, he will be having, or she will be having the anxiety. So this is going to be a constant, irrational, repetitive thought, right? What is compulsion? Compulsion is the motor act. It is the motor act. That means we are washing the hand. We are washing the hand. This is going to be the motor act to overcome the compulsion, to overcome the obsession. So this is the motor act. That means agar the most common type of contamination, let me write it down. Most common type of OCD we are having is obsession of contamination. This is also a question. Obsession of contamination, followed by compulsion of hand washing. Compulsion of hand washing. So there are going to be two component, दो component हो गए. First one is your obsession and second one is your compulsion. तो उसको बार बार लगेगा. If I'm touching this surface, I will feel like this particular thing, my hand is having now germs, and this particular thing, if I'm not washing my hand, if I try to control myself, what is going to happen? This is going to precipitate the anxiety. Even though I know there is nothing on my hand, still this obsession is going to increase the anxiety, and this anxiety will be subsided only when this person is going to follow the compulsion. That means only when the person is going to wash the hand. This is the most common type of OCD. This is the most common type of OCD that we are having. That is obsession of contamination followed by compulsion of hand washing. Compulsion of hand washing, right? So this is a ego syntonic thing. You agree with this? Sorry, this is a ego dystonic thing. You agree with this? Second thing, what do you think? The insight is present or not? What is the meaning of insight? Insight means awareness of illness. Insight का मतलब awareness of illness. So those people who are having the OCD, do they know about their disease or no? Do they know about their disease or no? So we are having like neurotic disorders, we are having psychiatric disorders, we are having psychotic, and we are having neurotic disorders. Remember, the insight will be present in the neurotic disorder. It will be absent in the psychiatric disorders, right? Mostly it is present in the neurotic disorder. Neurotic disorders like patient is having anxiety. अगर बंदे को anxiety है तो उसको पता होगा. If the patient is having obsessive compulsive disorder, he will be known by this particular thing. Psychiatric disorders like schizophrenia, this particular case, the patient may lose the insight. Patient may lose the insight, right? What about the judgment power of this particular person? Is it going to be normal or not? So this is a true statement. Option number B is a true statement. Option number C, judgment power is normal or not? Judgment is what? अगर आपके पीछे if we ask you, if there is a fire in the particular room, what you will do? This particular patient, the judgment will be normal. He will simply say, sir, I will try to escape, right? So this is going to be a normal judgment, and those people who are having OCD, the judgment power is going to be normal. So this is also a true statement. They want to know about the which one is the false. And the last one, reality testing is intact. Reality testing is absent. No, reality testing is not absent, it is going to be intact. So this is going to be the answer. D is going to be the odd one out, and this is going to be the answer in this particular case, right? Is that okay? Yes. Yes, one more thing, if they ask you about the most common type of obsession, most common type of obsession, then your answer will be simple: obsession of contamination, obsession of contamination, obsession of contamination. But if they ask you most common type of compulsion, most common type of compulsion, then your answer will be changing. Then your answer will be compulsion of checking, the compulsion of checking, लॉक करके वापस जाके चेक करना, that is going to be the most common type of compulsion. If they ask you overall most common type of OCD, that is going to be obsession of contamination followed by compulsion of hand washing. Most common type of obsession, that is going to be obsession of contamination. But most common type of compulsion, if they ask you, then those people who are going to check the lock again and again, that is going to be the most common type of compulsion, right? What about treatment in this particular case? In the treatment of OCD, we are going to give what kind of therapy? We are going to give behavioral therapy. We are going to give behavioral therapy. Okay, and we will be giving exposure and response prevention therapy also. Exposure and response prevention therapy. We are strengthening the person with the exposure and response prevention therapy. So this is going to be the question, right? Next question in front of you, try to answer. A 26-year-old male patient is presented to the OPD. He has a history of road traffic accident. This particular patient has a history of RTA in the past, and now he is coming with the complaints that he is afraid to see a truck. उसका ट्रक से एक्सीडेंट हुआ होगा, राइट? सो ही इज अफ्रेड टू सी अ ट्रक, उसको ट्रक देख के डर लगता है, राइट? एंड लुकिंग एट द ट्रक he runs away and he thinks that the truck will hit him hard again, and this is the thing which is affecting his life. He is trying to avoid such type of situation, and this is affecting his life. Which of the following condition is going to describe this? This is your NEET PG question. So is it a delusion of reference? I have told you delusion of reference, that means people are referring him. People are referring him. So right, so this cannot be the first, this cannot be the delusion, right? So A cannot be the answer. What about this delusion of persecution? This is the most common type of delusion. It is also not the answer. Delusion of grandiosity, that means he's thinking like he is a god or a superior person, right? So this cannot be the answer. The answer in this particular case is going to be PTSD. What is this PTSD? Yes, reference means self, right? What is this PTSD? Here, whenever we are going to talk about PTSD, you have to think in the terms of some history will be present. There is a road traffic accident history is already present, and there can be some traumatic or stress event history will be there. Traumatic or stress event history should be there. There is going to be some road traffic accident will be there, or some person has lost someone very loved one, right? There is a blast, or maybe this type of thing will be there. So that is going to be a traumatic or a stress or a event history should be present in the cases of PTSD, right? And symptoms will be when you are going to see the symptoms will be like anxiety, the symptoms will be like tremors will be there, palpitations will be there. Palpitations, tremors means what? Abnormal contraction of skeletal muscle is tremor. Abnormal contraction of cardiac muscle is palpitation. Palpitation, this particular patient can have sweating, right? Ultimately there will be some kind of a irrational extreme fear. There will be some kind of irrational extreme fear will be there. So these are the things you will be finding in the cases of PTSD. These are the things you will be finding in the cases of PTSD. Yes. Apart from this, in PTSD, you will be having some kind of intrusive symptoms. intrusive symptoms. Intrusive symptoms मतलब this particular person is going to have certain flashbacks. जो एक्सीडेंट हुआ था उसका flashback आएगा. There will be whatever has happened, he will be having whatever has happened, he will be having those flashbacks. Those flashbacks should be there. अगर वो flashbacks आते हैं, that is going to be in the favor of intrusive symptoms which is associated with the PTSD. Apart from this, he will be having arousal symptoms. He will be getting arousal symptoms. He will be getting hyper vigilant, hyperactive हो जाएगा, hyper vigilant. Hyper vigilance will be there. Apart from that, he will be having avoidance symptoms. He will try to avoid such situations. रोड पे जाना अवॉइड कर देगा, गाड़ी में घूमना अवॉइड कर देगा. Because of this PTSD, he will be having these type of symptoms, right? He will trying to avoid the, suppose उसका एक्सीडेंट हुआ था when he was traveling to the mountains, he will never go back to the mountains. He will trying to avoid such situations, right? He will never go back to the mountains. He will always try to avoid these symptoms, right? So these are the things you will be finding in the cases of post-traumatic stress disorder. After a trauma, this particular patient will be having certain stress disorder, right? So this is going to be your PTSD. This is going to be your post-traumatic stress disorder. Next question. Next question. A 23-year-old female patient have sadness of mood, okay, experiencing a reduced sense of enjoyment in activities that are previously pleasurable. This is happening from the last 1 month. This is happening from the last 1 month. How we will examine this patient? What is the thing we are going to do? Are we going to do a CT scan or MRI or MSc or MMSc? What is this MSc and MMSc? Yes, the diagnosis is she is not able to get the pleasure from things which are previously pleasurable. So this particular patient is having what? Anhedonia. This particular patient is having what? Anhedonia. Anhedonia is there, right? What is going to happen? We are not going to do any CT scan because there is no organic mental disorder. She is having some disorder with the psychiatric cause, right? So we are doing MSc. MSc is what? MSc is mental status examination. That is going to be a type of clinical examination. We are not going to go for the diagnostic tools. We are going to do the clinical examination. Hoga. And this mini mental status examination, MMSc, that is going to be mini mental status examination. That is going to be we are going to do in the cases of organic mental disorders. Organic mental disorders. In the cases of organic mental disorder, we are going to do what? Mini mental status examination. For example, like in the cases of dementia, okay, and we will be having a number that is going to be your 30, and the score, it should be more than 24. That is going to be your MMSc, right? So how we are going to see and what are the components of this particular thing, right? What are the components of this MMSc and MSc? Let's try to understand. First component we are having is general appearance and behavior. So whenever the person is coming, how he is looking, we will be understanding about that. How is the appearance of a person, what is the behavior of a person, is the person is greeting you, is angry or what, right? So that is going to be the general appearance. This is how we are doing. The clinical examination means what? We are assessing the things clinically with our knowledge, right? That is going to be clinical examination, right? Diagnostic means we are using some machines like CT scan or MRI machine, but right now in this particular case we are going to make the diagnosis clinically, right? So we are going to check for the general appearance and behavior. Second thing we are having is about the speech. Remember, I've told you, whenever the speed of speech is going to increase, it is going to be in the favor of mania. It is going to go in the favor of mania. If the speed of speech is going to decrease, what is going to happen? This is going to be in the cases of depression. This is going to go in the cases of depression. Banda hai, dheere dheere bol raha hai. That is going to go, that is going to tell us about the depression, right? What about the mood and affect? I've told you, mood and affect are going to be the emotions. They are going to tell us about the emotions. They are going to tell us about the emotions. Can anyone tell me where do we generate these emotions? These emotions are generated where, and they are controlled by what? FMG exam previous year question. Emotions are generated where and they are controlled by what? Okay, so they are going to be your mood and affect. Mood and affect. Mood is going to be a long term entity, whereas this affect is going to be a short term cross sectional entity, right? So this is going to be your mood and affect, right? What about thought? We have seen the formation of thought, we have seen the disorders of thought, right? Those four disorders, formation, all these things we have seen, right? What about this perception? Perception, we have seen there can be illusion, there can be illusion, there can be hallucination, right? These are the perception, right? So we can have illusion and we can have hallucination. What about this cognition? Cognition is going to be a higher mental function. We can check for the multiple things in the cognition, right? Apart from that, we are having judgment. Judgment, how you can check the judgment? You will be having you will ask the patient, अगर रूम में आग लग गई तो क्या करोगे? If the patient will say कि मैं उस आग में कूद जाऊंगा, that is going to be the right that is going to be the wrong judgment, right? That is going to be the wrong judgment. Tiger आ गया तो क्या करोगे? What will you will do? The patient will say, I will fight with the tiger, I will kill the tiger. So that is going to be the wrong judgment. This is how you will understand whether the judgment power is intact or not, right? Lastly, we are having insight. Insight is nothing but your awareness of the disease. Awareness of disease. Very good, very good. Arya, Mahi, Puneet, right? So emotions are generated from limbic system. All the emotions, love, hate, all the emotions are generated from limbic system. That is going to be responsible for the generation of emotions, but they are controlled by frontal lobe. They are controlled by frontal lobe. Frontal lobe has the function to control the emotions, all the emotions तो बहुत आते हैं, सब कुछ तो बाहर नहीं आता, right? So what is the thing that is controlling? That means your frontal lobe is intact. अगर कुछ भी बाहर आ रहा है, everything, like lots of people are there, they are having certain emotions and they just say it out. That means what? Frontal lobe में कोई issue है, it is not able to control the emotions, right? So that is going to be the thing, right? So next question, we are having a 32-year-old male patient presented to OPD with his wife, and the patient is telling that he is in love with the Alia Bhatt, right? The patient is in the love with the Alia Bhatt, and she is also loving him badly, right? She is also loving him badly. When her wife asks for the proof, that show me some proofs, he tells that someone has hacked their mobile and don't let the proof to see anyone, right? Which of the following explains the condition of the patient? Which of the following is going to be responsible for this condition of the patient? Which of the following is the syndrome that we are having? A 32-year-old male patient coming to the OPD with his wife. Patient बोल रहे कि I love Alia Bhatt, she also loves me, we are living together, but we are talking on phone, we are talking on messages, but I don't have any proof, right? So what is this particular syndrome? What is this particular syndrome? Is it a Cotard syndrome? Is it a D-Clembert syndrome, Othello syndrome, or Bobbitt syndrome? What is this? Limbic system damage. Yes, it can also get damaged in the cases of stroke, right? This thing can also get damaged. D-Clembert syndrome, also known as erotomania, delusion of love. Very good, guys. I think you guys know about psychiatry, right? Is it an interesting subject, right? So Cotard syndrome is what? Cotard syndrome, or you can remember nihilistic delusion. Nihilistic delusion, or delusion of negation. Delusion of negation. In this particular thing, what the person will say, Cotard syndrome में क्या होता है? Person will forgot his body part. There will be negation toward a body part. इस हाथ को भूल गया. He will forget that this hand is also this particular person is having this hand, right? तो वो भूल जाएगा एक body part को. He forgot his right side of the face, right? So that is going to be if there is absence of body part. अगर क्वेश्चन में दिया हुआ है absence of body part, अगर absence of body part दिया गया है, that is going to be in the favor of Cotard syndrome. That is going to be in the favor of Cotard syndrome, right? What do you think, guys? Do you think what is going to be the diagnosis here? This particular patient is not trusting his wife. This particular patient is having a fixed belief that this is the right statement that I'm telling you. Baki mere paas mein proof nahi hai, but this is the right thing that I'm telling you. So this is going in the favor of what? This is going in the favor of delusion. And can anyone tell me delusion is a disorder of? Is it a disorder of form of thought? Is it a disorder of content of thought? Right? Right answer. Right? We are having second one, that is going to be your D-Clambered syndrome. D-Clambered syndrome, also known as fantasy lover syndrome. Very good, guys. You are answering right. This is also known as fantasy lover syndrome. Fantasy lover syndrome, also known as erotomania. Also known as erotomania. Right? So what is going to happen? Very good, guys. This is going to be a content of thought disorder. Okay, 1 mark pakka. Right? Now what is going to happen? This is fantasy lover syndrome, D-Clambered syndrome, or erotomania. Here a person from lower socioeconomic status, a person from lower socioeconomic status will will fall in love with a person with higher socioeconomic status. Person with higher socioeconomic status. There is nothing like love, but this particular person will feel like that. Okay, this person is having delusion, and you already know delusion is a fixed and firm belief. If I say if I say that this particular person is in love with Alia Bhatt, and if he is agreeing on this particular thing and he's having a fixed belief, that means he is having delusion. But if a lot of people, and I also say that he is telling the truth, it is going to become what? It is going to become superstition. It is going to become the superstition. What is this Othello syndrome, or what is this delusion of infidelity? Delusion of infidelity, or morbid jealousy, or pathological jealousy. Right, this is a thing, this is generally seen in the alcoholic patient. अगर मेल को है, he will be thinking like that. Okay, but अगर फीमेल को है तो there will be a problem. अगर मेल को लगता है that our partner is cheating, he will be doing certain things. But if this particular thing is happening with the female, she will be doing something, and that is what is known as Bobbitt syndrome. What is this Bobbitt syndrome? This Bobbitt syndrome means the female is going to cut the female is going to cut the going to cut the genital of the male, cut the penis of male partner. Right? So this is Othello syndrome. This is going to be Othello syndrome, delusion of infidelity, or morbid jealousy, or pathological jealousy. यहाँ पर एक partner को लगता है that her partner or his partner is cheating on him, right? or her, right? So this particular thing is happening. अगर लड़के को लगता है that उसकी partner cheat कर रही है, it is a delusion that you already know that you cannot shake it, right? You cannot shake it. It will ultimately lead to divorce, right? But this particular thing is happening with the female. If some female, this is common with the alcoholic male, right? But this thing is happening with the female. She is going to do what? Like then Bobbitt syndrome हो जाएगा, right? So this is what is going to happen. Very good, Puneet. Very good. Your love for psychiatry is unreal. Okay, so what is going to be your answer? This is going to be your D-Clambered syndrome, fantasy lover syndrome, or erotomania. These things are confusing. All the things I have combined here together, so you can directly see it, right? And this is going to be a content of thought. This is going to be a problem with the content of thought, right? So this is going to be the Answer. Next question we are having, a 29-year-old female patient presented to you by her husband, and the lady has, this particular female, the lady has delivered a baby how many days ago? 6 days ago, by a normal vaginal delivery. Now the husband is complaining that she cries whole night, वो सारी रात रोती है, right? She could not sleep and don't eat anything, सोती नहीं है ढंग से, and she is not able to eat anything. These are the common cases, guys. When you go to the hospital, you are going for your internship, you will be finding such patients after delivery. She is feeling very low and she is having these type of symptoms, right? She always feel very low. General physical examination of the patients are normal and no other findings were there, right? Which of the following will be best describing this particular condition? You can expect 4 to 5 questions, definitely you can expect. But for the, if you want to learn more about psychiatry, I would suggest go for the branch psychiatry, right? If you are in love, right? So this type of questions they are asking very very commonly, like postpartum blues, depression, anxiety, or psychosis. How we are going to differentiate between them, right? This is what is important. Questions will be simple. You understand this particular patient is having some kind of depression, she is having symptoms of depression, but how you will understand, how you will try to answer. So this particular patient is having what symptoms? She is not able to sleep. And why these things are happening? All these changes, like female are having mood changes around the time of ovulation, right? Why these changes are happening around the time of like menses, right? Why these things are happening? Because of progesterone. The simple understanding, progesterone, loss of progesterone will produce these symptoms, right? So this particular patient is having what? Insomnia. This particular patient is having what? Depression. Symptoms of depressions are there, right? She is not able to eat anything, she is not able to uh, she is crying all the night, she is having mood reactivity is increased, she will be having increase in emotional reactions, she is having increase in emotional reactions, right? So these things are happening with this particular patient. Now let's try to understand what is a postpartum blue, what is a postpartum depression, what is a postpartum psychosis, right? So it is about the timeline. Blues will be happening with between 1 to 2 weeks. If the symptoms, what are the symptoms? The symptoms like irritability, symptoms like anxiety, mood fluctuation, emotional reactivity is increased. These are the symptoms this patient is having. So this patient is having what? This patient is having postpartum blues. This particular patient is having postpartum blues, and these are the symptoms that will remit spontaneously, that will be corrected automatically. You need not to worry about it, right? So that is going to be the postpartum blue because of progesterone, that is happening. What about this postpartum psychosis? Remember, this psychosis is happening between 2 to 8 weeks. This psychosis is happening between 2 to 8 weeks. If this thing is happening between 2 to 8 weeks, here in the question we have given what? We have given the first week. That is going to be blue. If it is happening between 2 to 8 weeks, that is going to be your postpartum psychosis. And remember, this particular case you need to do what? Hospitalization, right? So here this particular thing is happening. This particular symptoms will be mixed or rapid cycling will be there. Hallucinations can be there, delusions can be there, disorganized behavior can be there, and low insight will be there, right? This particular mother can harm the baby as well, right? So you have to be very very careful with the postpartum psychosis. Okay, you need to do the hospitalization, you need to do the treatment. This postpartum depression is happening after 8 weeks, after 6 weeks to 1 year. This is going to take a lot of time. Depression, that is going to be a 1 year. Symptoms will be, this patient will be having guilt, anhedonia, anxiety, depression of mood, insomnia, hypersomnia will be there. So these are going to be the symptoms, and here you need the prolonged treatment. Right? So 1 to 2 weeks is going to be the blues. Okay, 2 to 8 weeks is going to be the postpartum psychosis, and after that that is going to be the depression. Now you can easily answer this particular case. We are having what time? The timeline is simple. Yes, depression is going to persist for a long period of time. Yes, days are going to be the blues, right? So this is going to be your answer here. The answer will be A in this particular case, right? Next question we are having. A 17-year-old girl is presented to OPD with the complaints of excessive exercising and dieting and irregular periods. On further examination, the patient is having callousy knuckles and the BMI is 17.5, 17.5 BMI. What is the most likely diagnosis? What is the most likely diagnosis, do you guys think? Bulimia nervosa, Lawrence? Okay. Is it a bulimia nervosa? Is it a anorexia nervosa? Is it a binge eating disorder? Is it a avoidance restrictive food intake disorder? Bulimia? Okay, let's try to understand this. What is the normal BMI of a patient? What is the normal BMI of a patient? That is going to be 18.5 to 24.9. That is going to be the normal BMI of the person, right? What is going to happen in the anorexia person? Anorexia person will be a slim person. Anorexia nervosa will be a slim person. There will be dizziness, there will be irregular heartbeat, there will be low BP, poor concentration, shortness of breath, bloating, abdominal pain. All these things will be there, right? But the BMI will be low. BMI will be low over here. BMI will be low over here, right? What is going to happen in the bulimia nervosa patient? This patient is going to be a normal patient. This patient is going to be a normal patient. Here you will be having GIT problems, scrapings will be there, bloodshot eyes, dehydration will be there, and the symptom that you are seeing over here is the knuckles. Scraps on your knuckles will be seen here. Straps on your knuckles will be seen here. Yes, I'm telling you, just wait, Puneet. Okay, this particular thing, straps on the knuckles, will be seen here. Lastly, we are having this binge eating disorder, and this binge eating disorder is going to be the most common disorder. Most common eating disorder that we are having is going to be your binge eating disorder. Here they have given the BMI low, that is going to be your 17.5. This patient is having low BMI, whereas in the cases of bulimia, the weight will be normal. The weight will be normal. The weight will be normal. So here in this particular case, what is going to happen? This particular patient is going to have the diagnosis of anorexia. This particular patient is going to have the diagnosis of anorexia because the BMI is given low, and reason being, some people, those people who are having anorexia, even if they eat something, first thing, they are not able to eat a lot of things. And second thing, even if they eat something, they can also do the purging. They can also do the purging, and because of that, what can happen? They can also have callousy knuckles. They can also have callousy knuckles. What will happen in this avoidance restrictive food intake disorder? Here the volume of the food is decreased. Here the person is decreasing the volume of the food he is intaking. Volume of food is decreased. Whatever the food that he is eating, it has decreased the volume of the food. It can be due to smell of the food, it can be due to texture. It is not due to some psychiatric disorder. It is due to it is due to texture of the food, or maybe the type of food this particular person is restricting the food intake, right? So that is going to be the avoidance restrictive type of food disorder, right? Next question we are having. A 19-year-old girl brought to the OPD with the complaints of recurrent episodes of increased cardiac contractility. What is that increased cardiac contractility? Can I call it palpitation? Yes, right? Sweating is there, insomnia is there, and problem in breathing. She is having problem with the breathing as well. That means she is also having the dyspnea. When she feels this symptoms, she is having a feeling of impending doom. Very, very characteristic thing. Very, very characteristic thing. Feeling of impending doom. What is the likely diagnosis in this particular situation? Panic attack. All of you are answering panic attack. Lawrence, Rahul, Wasim, Anas, Puneet. So all of you are going to get this particular answer wrong. Let me correct it for you. This is not a panic attack. This is not a panic attack. Yes, Mahi is answering C. Mahi is answering C. Very good, Mahi. Apart from that, everyone is answering panic attack. Did you forget about this particular word? What is this particular word? He is having complaints of recurrent episodes of increased cardiac contractility. Yes. So these are all the symptoms of what? These are all the symptoms of anxiety. There is increased cardiac contractility. I can also call it palpitation. This particular patient is having what? Sweating. This particular patient is having insomnia, is not able to sleep. Problem in breathing, that is going to be your dyspnea, right? And these symptoms, when they are coming, this particular patient will be feeling like he is having what? Myocardial infarction. He is having what? He is having anxiety. He is about to die. He is having feeling of impending doom. All these things are going to go in the favor of anxiety. What is this happening? This is anxiety. So remember, whenever this particular thing you are seeing, normal anxiety, you understand, but whenever you are seeing the anxiety along with this impending doom, you will be having intense anxiety. That is going to be in the diagnosis, that is going to be in the favor of panic attack, that is going to be in the favor of panic attack. But don't forget to remember this particular word. If this particular thing is happening from a recurrent, from a lot of time, these episodes are recurrent, then you have to think in the terms of, if they are the recurrent episodes are there, if recurrent episodes are present, you have to go in the terms of panic disorder. This is going to be your diagnosis then, panic disorder. Okay, yes, this is going to be the diagnosis. You understand, this type of question they are giving you, and then this is the only thing, you have to read the question very very carefully. You need to get the words out. This recurrent word has changed your answer, and most of you have answered the A option, right? So this is going to be the important thing, right? This is going to be your panic disorder. This is going to be your panic disorder. What about the PTSD? PTSD, I've told you, this is going to be after any stressful event. After any stressful event, this is going to be the PTSD. If these symptoms, remember, if these symptoms are starting, after 6 months, if the symptoms of anxiety after a traumatic or a stressful event, let's say someone is dying, right? Someone close to someone has now no more, right? Now what is happening? This particular, let's say there is a father, and the father is dead now, and now the daughter is not having the symptoms for the first 6 months, but after 6 months she is having symptoms of PTSD, right? After 6 months, the symptoms of PTSD, this particular person is known as, this particular patient will be having what? Symptoms of delayed PTSD. The diagnosis, if it is more than 6 months, you will be going in the terms of delayed type of PTSD. Okay, normal PTSD, just after the event, that is going to be post traumatic. After a traumatic event, that is going to be post traumatic stress disorder. But if the timeline is more than 6 months they have given you, you have to tell the answer. That is going to be your delayed type of PTSD. Delayed type of PTSD, right? You understand? Next question. Yes, Puneet, the examiner, if I am the examiner, I know where you guys will be marking the answer wrong, right? Every examiner knows what they have to give to you so that you can make the answers wrong. Then you will feel like that we know everything, we are marking the answer right, but still there is some catch in the question, right? So examiner is superior. You need to understand how the examiner is asking the question. If you understand, if you solve this type of question, these are all clinical questions I am teaching you. I'm trying to explain most of the options along with that. If you understand, if you solve questions like this, trust me, it is going to be very, very easy for you. If you develop this type of habit, right, it will be very, very easy for you, not just in your FMG examination, be it your any examination, be it your NEET PG, be it your Central Institute examination. If you understand how to rule out the option, how to understand the keywords, it's just like a game. You will understand theory, everyone is reading, everybody knows about these things, but the keywords are the main game player, right? You have to understand those game changer words, those buzzwords, those keywords. Once you understand that, it will be very, very easy for you. It will be a just like a cakewalk. Okay, so now tell this question. 45-year-old patient is having issues with the neighbor from the last 5 years, right? And he always thinks they want to harm him. So what is this? They want to harm him. What is this? And he also hears certain voices. This particular person is having voices. So in psychiatry, voices is what? Auditory hallucination, which are inaudible by others. The diagnosis, you already know, the diagnosis was schizophrenia. They may not be giving you the diagnosis in the examination. Okay, and this particular patient was started on haloperidol. After the last night dose, his eyes are rolled up, or for a few hours he was brought to the emergency. What is the drug this patient is needing now? Yes, what is the drug would you like to give? First of all, let me make you the diagnosis. What is the diagnosis over here? This thing is happening normally. What is going to be your diagnosis? This is going to be your, yes, this person is having delusion of persecution. Delusion of persecution. This person is having auditory type of hallucination. This person is having auditory type of hallucination. This person is having schizophrenia. And the diagnosis, after diagnosis, we are giving antipsychotic, that is going to be your haloperidol. And after giving haloperidol, this patient is having certain problems. The eyes are getting rolled up, right? And this is what is happening. And what is the diagnosis in this particular scenario? What is your diagnosis? Status epilepticus. No, Arya, it is not about that. This is the extrapyramidal symptoms. Very, very important. These are the extrapyramidal symptoms this particular patient is having. Remember, we are giving two types of antipsychotic. One is your first generation antipsychotic. Second one is your second generation antipsychotics. First generation has superior D2 activity. They are going to inhibit your dopamine. Remember, simple understanding, dopamine कम हो गया, that is going to lead to depression. Dopamine ज़्यादा हो गया, that is going to lead to mania. That is going to lead to mania, right? So first generation are going to block the dopamine receptors, whereas this second generation is going to block the dopamine receptor. Along with that, it is going to block the serotonin also, right? 5-HT2A receptors, right? So it is also going to work on the 5-HT2A. First generation drugs like haloperidol, droperidol, right? These are the drugs which are going to work on this D2 receptor, and the side effect more commonly will be extrapyramidal symptoms, and they are going to be more effective against positive symptoms. Positive symptoms I have told you, like hallucination, patient is having hallucination, patient is having illusion. This type of symptoms will be treated very easily with the first generation drugs. Second generation, they will be having certain side effects. Side effects will be metabolic side effects. Here the person will be having metabolic side effect like hyperglycemia, hyperlipidemia, weight gain. These are going to be your metabolic side effect. Weight gain will be there, hyperlipidemia will be there, right? So these are the side effects you will be finding with the second generation drugs, and they are going to be more effective against negative symptoms. These are the drugs like clozapine, olanzapine, okay, risperidone, ziprasidone. These are the drugs which are going to be more effective against negative type of symptoms. So this is a basic history, right? Now, what about the treatment of this extrapyramidal symptoms we are having? The first one in the list we are having is acute dystonia. And remember, this is the earliest one. What you have to remember, this is the earliest symptom that we are having, acute dystonia. Dystonia means abnormal tone will be there. There will be uncontrolled muscle spasm, mostly over the face, mostly over the tongue, rolling back of tongue will be there, right? This is what is happening, right? And it can be due to around the neck, right? There will be torticollis, right? So all these things can happen, right? This is going to be your acute dystonia. This can happen within 1 to 5 days. This is going to be the earliest extrapyramidal symptoms that we can have, right? This is going to be the earliest. And for the treatment of this thing, the treatment you should be knowing, this is a very high yield table. Definitely they are asking question from this, right? For the treatment, you are giving promethazine or phenargan. Promethazine, or another drug that you can remember is benzhexol. These are the two drugs that you should be remembering. One is your promethazine, another one is bench hexol, another one is bench hexol. So this is the thing which is happening, and the answer here you will be giving what? Injection of promethazine or phenargan, and the patient will be corrected within few minutes after giving this injection, right? Second symptoms we are having is Parkinsonism. Why this Parkinsonism is happening? Remember, in this particular cases of mania, what we are giving, we are blocking the D2, we are blocking the D2, we are blocking the dopamine. If this dopamine is going to get blocked in the nigrostriatal pathway, what is going to happen? Decrease in the dopamine in nigrostriatal pathway will lead to a disease that is known as Parkinson. That is known as Parkinson. So this antipsychotic drugs that can cause drug induced Parkinsonism. Okay, drug induced Parkinsonism can happen within a month, it can happen, right? And there will be rigidity, there will be bradykinesia. This type of patient will be walking, taking slow steps, patient will be having tremors, right? This thing can happen in the Parkinsonism. This type of tremors will be there, right? Next we are having is akathisia, resting type of tremors will be there. Resting tremors will be there, right? Intentional tremors you will be finding in the cases of when you are having lesion in the cerebellum में disease होगा, then you will be having the intentional type of tremors, right? What is this akathisia? That this particular patient will be walking here and there, right? If this particular symptom is happening, and remember, this is going to be the most common symptom, this is going to be the most common symptoms. First question, earliest is going to be acute dystonia. Treatment will be benzoxole or promethazine. Akathisia is going to be the most common, and the treatment will be propranolol. Propranolol, right? Propranolol is a beta blocker we are giving here, right? Next one we are having is neuroleptic malignant syndrome. It is going to occur within weeks to month. Even if you don't remember the timeline, just remember what is going to happen. This is going to cause muscle rigidity, fever will be there, unstable BP, hypo myoglobinemia will be there, and the treatment will be dantrolene. Remember, in physiology we have discussed that this particular dantrolene we are also using in one more malignant thing, that is going to be your malignant hyperthermia. We are also using IV sodium dantrolene, right? Lastly we are having tardive means late, and dyskinesia, abnormal movements will be there, involuntary painless movements on the face or upper limb will be seen, right? This is going to be the tardive dyskinesia. If you want to write about the drug of choice, we can use valbenazine. Valbenazine. This is going to be a long-term side effect. This is going to be a long-term side effect that is happening after such a long period of time, right? So we are using the typical drugs, we are using atypical type of antipsychotic drugs. Someone is having schizo, we are giving typical or atypical depending on the symptoms. This person is having more like positive symptoms, hallucination is there, patient is having illusion is there, so we are going in that we are going with the first generation drugs. If the patient is resolved with the first generation patient is resolved with the positive symptoms, then we are going to give the second generation drugs which are going to work more on the negative symptoms. All the negative symptoms like asociality is there, apathy is there, anhedonia is there, he's not talking to anyone, right? All these symptoms, evolution is there, so everything will be covered with the negative coming under negative symptoms and covered with the second generation antipsychotic drugs, right? So this is the difference. Second generation are generally going to cause the metabolic side effect. One more thing, do study about the olanzapine, very important, right? Next question in the list we are having a 32-year-old male patient who is a known case of generalized anxiety disorder, GAD is there, presented to emergency with the complaints of feeling of impending doom. Okay, the preferred drug would be, now you're first of all, before drug I would like to know what is the diagnosis, what is the diagnosis that you are making? Is it a case of panic attack, or is it a case of panic disorder? Yes, what do you think? Is it a case of panic attack or a panic disorder? Yes, my dear students. Very good, Rahul. So this is going to be a panic attack. Yes, Arya, this is going to be a panic attack. This is going to be a case of panic attack. If they ask you simple question, this is a previous year question. If they have asked most common psychiatric group of disorder, if they ask you most common group of psychiatric disorder, what is going to be your answer? Most common group of psychiatric disorder. This is a question they have asked you. And if they ask you most common psychiatric disorder, answer me. Most common group of psychiatric disorder, and what is the most common psychiatric disorder? So one question they have asked in your examination. So remember, most common group of psychiatric disorder is going to be your anxiety related disorder, anxiety disorder. Whereas if they ask you most common psychiatric disorder, then your answer is going to be in the terms of specific phobias. People are having specific phobias, that are going to be the most common psychiatric disorder overall, right? So this is what is you have to remember. For the treatment part, you have to remember how we are going to treat. First of all, we are going to give the psychotherapy. We are going to give the psychotherapy along with the pharmacotherapy. Along with the pharmacotherapy, दवाई भी देनी है और साइकोथेरेपी भी देना है. Pharmacotherapy. So psychotherapy along with the pharmacotherapy. Okay. They are SSRI. Why we are not giving SSRI directly? One thing you have to remember, those SSRI are going to be the drug we are going to utilize. But the important thing is what? The important thing, they are going to take certain times. They are going to take certain times in the starting. Whenever a person is coming, always the doctor is writing what? They are writing benzodiazepines. They are just depressing the brain. They are increasing the GABA, right? What benzodiazepines are going to do? They are going to be used in the cases of short-term uses. So benzodiazepines are going to, they are going to be in the which class? They are GABA mimetic or GABA facilitatory. They are GABA facilitatory. They are going to increase the GABA, and we already know GABA is a inhibitory neurotransmitter. So it is going to inhibit the impulses in the brain. So for short-term treatment, we are going to give the benzodiazepine. For long term, we are going to shift our patient on the SSRI. Reason being, this SSRI is going to take approximately around 7 days. It will take around 7 days. Yes, we are giving alprazolam, right? Alprazolam, we can give alprex, right? So that is going to be the answer in this particular scenario. You understand? Right? Now let's discuss about the classification of the antidepressant drugs. We are having different type of antidepressant drugs. We are having SSRI, we are having SNRI, we are having serotonin receptor antagonist, we are having MAO inhibitor, TCS, right? So these are the drugs we are having. The important one we are going to discuss. These are your SSRI and these are your SNRI. Two you can remember. One is your escitalopram or citalopram from the SSRI, fluoxetine, okay, paroxetine. They are going to be your SSRI group of drugs. SNRI, you can remember deluxe van, duloxetine and venlafaxine. This much you can remember, and milnacipran. Deluxe van mein milna, you can remember like that. So these are going to be your serotonin norepinephrine reuptake inhibitor. This is going to be selective serotonin reuptake inhibitor. This is going to be selective serotonin reuptake inhibitor, right? These MAO inhibitors, TCAs, these are going to be your TCA and MAO inhibitors, right? So how you can utilize these drugs? These SSRI, remember, they have a specific side effect that you need to know. What is the side effect that this SSRI are going to do? They are having a specific side effect. What is the side effect we are having? Is it going to cause, it is going to increase the time of ejaculation, or you can say it is going to treat your delayed, sorry, it is going to cause delayed ejaculation. It is going to cause delayed ejaculation. So you can use these drugs in the cases of premature ejaculation. Those people who are having premature ejaculation, we can use these drugs. They are going to cause delayed ejaculation, but they are going to decrease the, no Mohammed, it is not going to go, treat erectile dysfunction is a different entity. Erectile means erection is there, erection will be having problems. So what we want our vessels to get dilated. So we want vasodilation, and vasodilation we use drugs like nitric oxide, and nitric oxide like sildenafil. So sildenafil you are going to use for the cases of erectile dysfunction. Tadalafil is the longest, right? And this particular thing we are going to use what? For delayed ejaculation we are going to use SSRI group of drugs. They are going to produce their action after a certain point of time, like after 7 to 10 days you are taking this continuously, then you will be able to have the action, right? But this erectile dysfunction, it is going to get treated with a single dose, right? So this is what is important. This TCA can cause toxicity. It can be it can cause myocarditis. It is cardiotoxic drug, right? So this is what you need to remember. MAO inhibitor you have studied about in pharmacology, about the cheese reaction. That is what you need to remember, right? Next question we are having. A man brought her wife to OPD and she has and he has complained that she is very shy. The female is very shy and don't speak much. वो ज़्यादा नहीं बोलती. She don't speak much and very mature and calm since beginning. So he has got the best wife, right? But last week he saw her flirting with some guys. Last week उसने क्या देखा? She was flirting with some guys, and when he asked that why you were flirting, then she said that she could not recall any of this. She could not recall any of this. And during the fight she started to talk like a child. She started to talk like a childlike voice and started crying. What is the most likely diagnosis of this particular patient? I think this question is new for you. I hope you are able to answer this. So this is a female. She was very nice since beginning, and one day her husband has find out that she is talking with some other boys. She is going. No, it's not a case of bipolar, Mohammed. Right? She's talking or she's flirting with someone. Right? He find out that she's flirting with someone, and and this particular person is thinking that my wife cannot do this. Right? When he asked this particular when he asked his wife why you were doing that, so she said that I don't even remember anything about this. And she started talking to him when he fight with his wife. She started to cry. She started to cry, and she started to talk like a child. So is it a identity disorder? Yes, you must have seen the movie. There is a movie Aparichit, right? You must have seen the movie. So this is a case of DID. What is that DID? Have you heard about this term? Multiple personality disorder. This is the multiple personality disorder. Multiple personality disorder. Right? So what happens in multiple personality disorder? This particular person does not remember. This particular person does not remember what he was doing. He has changed his personality completely. है ना, movie देखा होगा, you must have seen those movies. So this particular person is having what? He cannot have depersonalization. He's not having bipolar. He's not having depression. He's having what? He's having dissociative identity disorder. Let me make you understand what is this dissociative type of identity disorder we are having certain things. Dissociative amnesia. Amnesia मतलब क्या हुआ? So we are having four types of dissociative disorder. First one, dissociative amnesia, हम भूल गए. Second thing, depersonalization or derealization disorder. Third one is your dissociative fugue, and lastly we are having DID, that is going to be your dissociative identity disorder. Okay, dissociative identity disorder, right? So what is going to happen over here? Dissociative amnesia, here you will be having problem with the memory. Here you will be having problem with the memory. That means after a stressful event, like you must have seen in your childhood, maybe there are certain events, like there are certain events in the childhood which are depressed by your brain. So all those stressful event, कुछ बातें ऐसी होती है, कुछ चीज़ें ऐसी होती है that you don't even remember right now. Why? Because your brain has depressed those things are so stressful, उनको दबा दिया दिमाग ने, right? So those stressful events in childhood that you cannot even recall, right? So there will be certain problem with the memory, that is going to be your dissociative amnesia, उन feelings के साथ में टूट गया, right? So it is a condition where a person is unable to remember essential details from their past. They are not able to remember because past इतना अच्छा था ही नहीं, it was a very bad thing, right? Second we are having is depersonalization or derealization disorder. So what is going to happen in depersonalization or derealization? Personalization matlab and realization matlab, these are both different entities. Okay, in one thing there will be loss of self, in one thing there will be loss of self, that means banda khud se detach ho gaya, that is going to be depersonalization. Derealization means loss of external world, वो खुद से और दुनिया से दोनों से बाहर हो गए, दैट इज गोइंग टू बी लॉस ऑफ एक्सटर्नल वर्ल्ड और एनवायरनमेंट, यू कैन से external environment or world, you can say, right? So this particular person is coming out of his body, he's looking at the things, that is going to be your derealization disorder. Depersonalization will be having this person is coming out of himself, right? So that is going to be loss of self, right? Next one we are having is dissociative fugue. Dissociative fugue, what is going to happen? This particular person is going to get away from the house. You must have seen कुछ लोग घर छोड़ के चले जाते हैं, नई जगह पे रहने लग जाते हैं, they have started a new life. They started a new life, they travel to a new place, they forgot who they were, they forgot what they were, they are having some issues with the brain and they are just going away and they are started living at that particular place with a new identity. That is going to be your dissociative fugue. This is going to be your dissociative fugue. And lastly we are having DID, that is going to be dissociative identity disorder, that you have seen in the movies. That is what is going to happen in this particular case. यहाँ पर बंदा क्या होगा, अलग अलग changes लेगा, अलग अलग he will be in the different roles, and all those roles maybe they are not connected with each other. When this particular person is normal and tries to recall, he will be thinking like that there's nothing like that is happening, right? So that is going to be your dissociative identity disorder, right? Lots of people are having this, वो जो बाबा आते हैं, देवता आते हैं, you must have seen. So all these things are what, these are your dissociative identity disorders, right? So this is going to be the DID. Next question in the list, we are having a known alcoholic patient is presented to the emergency department with the complaints of palpitation. This patient is having what? Palpitation and subconsciousness, suspiciousness will be there. On examination, there are tremors are present. This particular patient is having what? Tremors, and pulse rate is 125 per minute, and he is oriented to time, place and person. The attendant also give the history of a seizure episode a few minutes ago. He has a seizure, right? And what would be the best line of management? First of all, what is the diagnosis that we are making? This particular patient is having what? These are the symptoms. These are the symptoms of what? These are the symptoms of the diagnosis will be alcohol withdrawal. Remember, alcohol withdrawal should be done under the care of the doctors, under the care of the hospital. It should not be done in a normal thing, right? You know what is going to happen if you close someone inside a room for 3 days without alcohol? This person is going to die. I have seen a patient, he was closed by his own son for 3 days without alcohol, and the person is dead. I'm going to make you understand how this is happening. This is the withdrawal timeline that we are going to understand. What are the symptoms that will come? So this is how we need to take the care from the doctors, right? What is the drug of choice for alcohol withdrawal? Remember, alcohol क्या करता है? What smoking is doing? Smoking is activating your brain, whereas the alcohol is depressing your brain. Alcohol is depressing your brain. So what is going to happen? We need to depress our brain. So the drug of choice in this particular case will be benzodiazepine. That is going to be benzodiazepine. More properly, we are giving which kind of benzodiazepine. Let me get the answers from you. So what do you think answer will be here in this particular case? B. Chlordiazepoxide, rectal diazepam, and A. Camprosate. What is this rectal diazepam? Diazepam is what? Is it a benzodiazepine? Yes, it is a benzodiazepine, but it is very uncomfortable to take the drug rectally. So This is a benzodiazepine, but it is going to be uncomfortable here, right? What about this acamprosate? This is going to be an anti-craving agent. It is going to decrease the craving. And naloxone we are going to use in the cases of opioid poisoning. Those people who are taking the opioid, in those patients we are giving what? Opioid poisoning patient, we are giving what? Naloxone is the antidote, first line. Second line we are giving naltrexone. जैसे ही बंदा आता है, बेहोश आएगा, meiosis होगा, all the symptoms you will be seeing, mainlining will be there, right? Injection लगाता होगा, right? This particular patient you will be giving naloxone. What is going to happen? This person is going to get fine within few hours, right? Like 30 minutes will be enough, right? So within 30 minutes this patient will be fine. Now it is your responsibility to give this particular patient what? Naltrexone. Naltrexone is the drug we are going to put. Naltrexone we can use already orally, and we will be giving this naltrexone to this particular patient for the opioid poisoning. Opioid poisoning, right? And this chlordiazepoxide, yes, remember this is also a benzodiazepine, and it is going to be the drug of choice that we are going to use. Chlordiazepoxide, it is a long acting thing. Diazepoxide, it is a long acting drug that is going to depress the brain for such a long period of time, and the patient will not have the urge to drink more alcohol, because the brain is already depressed, right? Brain active होगा तो उसको अर्ज होगा वापस से, right? This particular thing is going to depress the brain throughout, and this particular person is not going to have the aggravation of the symptoms, right? And we can also use drugs. Yes, we can also use drugs. We can also use drugs like lorazepam. You know, in government setup we do not have this chlordiazepoxide sometimes, so we can also go for lorazepam, because you can remember L4 lorazepam, it is going to be safe in the liver failure. It is safe in the liver failure, and this particular thing is going to cause what? Alcohol is going to damage your livers, right? So we can also use, sometimes we can use in this particular case lorazepam also, right? You can remember this, right? What is the withdrawal timeline that we are having? What will happen in the first 6 hours? You will be having anxiety, you will be having insomnia, you can have these symptoms. Most likely, if I want to tell you, tremors will be the most important thing. For 1 to 6 hours, what is going to happen? The person is going to have abnormal contraction of the skeletal muscle, and this is what is known as tremors, right? 12 to 24 hours after the alcohol withdrawal, this particular patient can have hallucinations. This particular patient can have hallucinations. He can have auditory hallucination, he can even have visual hallucination, right? 24 to 48 hours, this patient can have seizures. This patient can have seizures, withdrawal symptoms, shaking, heavy sweating will be there, seizures will be there. So that is going to happen within 1 to 2 days, right? After 2 to 3 days, this person is going to go into delirium tremens. Delirium tremens. Delirium tremens, there will be very high elevated temperature, seizures will be there, there will be high heart rate, palpitation will be there, tachycardia will be there, all these symptoms will be there, and after 72 hours this patient can might even die. After this patient can might even die. He will be having very high blood pressure. So this is what you need to remember. You need to give which drug for alcohol withdrawal patient. अगर alcohol कोई long term से ले रहा है, if someone is taking alcohol for such a long time and you are thinking like उसको ऐसे ही छुड़वा देते हैं, so this is not going to happen. What you see is going to happen, right? So as a doctor you should be knowing, we should be depressing the brain, we should be giving benzodiazepine, and it should be done under the direct observation, right? So this is going to be the benzodiazepine, and the drug of choice will be chlordiazepoxide. We don't generally get the chlordiazepoxide, we can also use lorazepam and sometimes clonazepam as well, right? So that is for the clinical, but as for us, this particular thing is concerned, you have to be very very careful, right? Next one, a 23-year-old male patient was on the treatment of depression. Patient को क्या है? Depression है. Patient is on the treatment of depression, and he has consumed a large number of tricyclic antidepressant pills. He has consumed TCA pills, a lot of TCA pills during the depressive episode, and brought to the emergency room with the hypotension. This patient is having now hypotension, altered sensorium, and EEG is showing what? Wide QRS complexes, right? What is the best step in the treatment of this particular patient? What would you like to give this particular patient? So the diagnosis is in front of you. Diagnosis is TCA toxicity. Very, very examiner favorite question, TCA toxicity. And because of this tricyclic antidepressant toxicity, what is going to happen? You are going to have what? Metabolic acidosis. Now maybe you can answer. Very good, Puneet. So here we would like to give what? We would like to give soda bicarb, and soda bicarb also we are giving IV. That is going to be what? That is going to be a neutralization thing. That is going to be your neutralization thing, right? This is what we are going to do, right? TCA we are also giving, we are avoiding TCA, reason being it is cardiotoxic, right? It is cardiotoxic, we are avoiding it, but we can use SSRI, we can use SNRI for the treatment of depression, right? SSRI for the mild to moderate maybe, but this SNRI we are using for the severe cases of depression, severe type of depression we are using SNRI, right? So this is what is important. Next one, Priya, a 24-year-old female, wants to be the center of attention. Okay, so she wants to be the center of attention and exaggerates everything. She exaggerates everything, right? Making it sound very, very important than it really is. She behaves in an extrovert manner, and sometimes she uses physical appearances to draw the attention of the people. She can be best suited in which of the category? So she's behaving in an extrovert manner. She's using some physical appearances to draw the attention. Those people on the reels nowadays, right? So they are having some kind of a personality disorder, right? So are they happy with themselves? What do you think? Are they happy with themselves? Yes, these are the people, they are happy with themselves, right? So this is a personality disorder, and personality disorder is going to be ego syntonic. Ego syntonic means it is going to be loved by the self, it is not going to cause any problem. So is it a case of mania? Is it a case of a borderline personality disorder, narcissistic or histrionic personality disorder? Some are saying narcissistic, some are saying histrionic. So let me make you understand what are the different kind of personality disorders we are having. So we are having type A cluster, type B cluster, and type C. Type A cluster will be having paranoid type of personality disorder, schizoid personality disorder, and schizotypal, right? So these are the people, if I want to talk about in general, they are the people which are having old and eccentric ways of thinking. Old ways of thinking will be there. Okay, type B personality, they are the dramatic people. They are going to be dramatic people, dramatic or erotic people. Type 2 B personality is going to be dramatic and erotic people, whereas C wale jo honge, these are your anxious people. These are going to be your anxious. These are going to be your fearful. इन्हें हमेशा डर लगेगा. They are going to be anxious, right? So this type of people are going to be in the type C personality. So what are the examples we are having? We are having type B, antisocial. These are the people, antisocial people. You understand what are those antisocial elements we are having? Histrionic personality, narcissistic, and emotionally unstable personality disorder, right? Lastly, type C will be having avoidant, obsessive compulsive, and dependent. These people are always anxious, they are always dependent on the other people, right? So let me just make a short notes about all of these. So in the cluster A, we are having what? Paranoid type of personality. First one we are having is paranoid type of personality. These are the people, they are always suspicious. These are the people, they are always suspicious. They don't trust anyone. They don't trust anyone. Okay, these are the people, अगर आप ATM मांगोगे या कोई पिन मांगोगे, they will be thinking like that my account will be empty, whether their account do not have even money, but still they will be thinking like that. These are the suspicious people, they always do suspicion, right? Schizoid, second one we are having is schizoid. Schizoid. Schizoid people are generally socially detached people. इन लोगों को ज़्यादा लेना देना नहीं. They are socially detached people. They are socially detached. They do not have. They are having less emotional expression. They do not express themselves, emotional expression. These are going to be your schizoid type of personality. Lastly, we are having schizotypal. They are also socially discomfort. They are also socially discomfort, right? Socially discomfort people. Here you will find cognitive. Here you will find cognitive distortions will be there. Cognition means there will be a filtration on the brain. Cognition means there will be a filtration on the brain. Remember, I've told you about this poisoning, like belladonna or atropine poisoning. What is common? There is loss of the cognition. Cognition मतलब जो भी कुछ बोल रहा हूँ वो with filter बोल रहा हूँ. That is what is basically my cognition is intact, right? So this is going to be your schizotypical patient. So typical, right? Apart from that, we are having cluster B. In cluster B, cluster B, we are having anti-social type of personality. Anti-social type of people. These are the people that don't do mercy on others. They do not have mercy, no mercy. These are the people who will break the road traffic rules, right? No mercy, no no mercy, no following of the rules, or they are basically violates the rights of others. इन्हें बस अपनी पढ़िए, right? These are the people which are anti-social people. These are the people which are anti-social anti-social people, right? Borderline. These are the impulsive type of people. Impulsive type of people. They do not have a relationship. They do not have stable relationship. Okay, they always have unstable relationship, but they are always impulsive. थोड़ा कुछ होगा, they are going to be like, this is the best, right? So there is going to be unstable relationship, right? Then we are having histrionic. These are the people which requires the excessive type of attention. These are the people who are always coming on the social media. They are going to be attention seeking type of people. They require excessive type of attention. होते कुछ लोग, right? Excessive attention seeking behavior will be there, right? So these are the people which are going to be in the histrionic type of thing, right? I'm just telling you for the examination purpose. These are the keywords they are giving you. For the narcissistic people, they do not have empathy. They will be lacking empathy. They are like they think like they are the god, right? So there will be some grandiosity component will be there. Okay, there will be some grandiosity component will be there. There will be absence of empathy. Empathy will be not there, right? So these are the cluster B, right? Yes, all of them are drama buzz. Cluster C, here we are having avoidant type of personality disorder. इनको rejection बर्दाश्त नहीं होता, right? These are the people who are not able to take up the reaction. These are the avoidant. They are hypersensitive. The question they will give you like that. These are the people which are hypersensitive to negative evaluation. ये जाते ही नहीं है इस चक्कर में, because they will be avoiding the things because someone will judge them, right? Avoidant personality. Then we are having dependent type of personality. Dependent type of personality disorder. These are the people which are dependent on others. They are always submissive type of people. ये किसी ना किसी के साथ में रहेंगे हमेशा. कुछ भी काम करना होगा, they will be with someone. They are submissive. They are dependent on others. And lastly, we are having OCD. Obsessive compulsive These are the people which are always running towards perfectionism. Perfectionism. Perfectionism and control, right? So these are the people, they are obsessive compulsive type of personality, right? So these are the basic personalities we are having. They are asking question, they are just giving you the simple keywords, right? You have to pick up the keyword, you will be getting to the answer. Like in this particular question, they have given that there is a girl, she wants to become the center of attention, she's talking in an introvert manner, she is drawing attention of the people with the physical appearances, right? So she want what kind of personality disorder this particular female is having. So this particular female is having what kind of disorder? Yes, this is going to be a histrionic type of personality disorder, right? You understand this, histrionic, because they are having excessive attention seeking behavior, right? So this is what it is. Next question we are having in the list, we are having all of the following are feature of pseudo hallucination except. All of the following are feature of pseudo hallucination except. तुम्हें बड़ा मजा आ रहा है उर्फी जावेद. Anyways, right? Whatever you can remember, however you can remember, you just need to remember. That is the real purpose, right? So what is this hallucination? Hallucination, you already know, is going to be the false perception of the false perception in the absence of an object. That is going to be the false perception, absence of object. It is going to be vivid, it is going to be vivid, that means they can see clearly. That is going to be the hallucination. It is going to occur in the outer subjective space. Okay, it is going to occur in the outer objective space, right? It should be in the environment. But if the same thing is happening in the subjective space, inner subjective space, then the answer will be, yes, it is a misprint. It should be in the inner subjective space. Then your answer will be C. It what are the features the hallucination should be having? Pseudo hallucination, this is an important topic. Last year they have also asked the question, right? They occur in without stimulus. Yes, it is a true statement, they do not require stimulus. Suppose I want to have hallucination, I cannot have hallucination like that. Okay, they come by their own. They are vivid, I can see things clearly, you can see things clearly, right? They are under the willful control. No, they are not under the willful control. They are not under the willful control. So this is also going to be the true statement. They are perceived in outer objective space, then it is going to become the hallucination. But if it is perceived in the subjective space, मतलब आंखें बंद करके या अंदर से कुछ आवाज आ रही है, the person is hearing voices. Listen to me carefully, the important question I'm telling you. If they are talking about voices, and the person is telling that the voices are coming from outside, the voices are coming from outside or objective, or from the environment, someone is talking something. So this is going to be a hallucination. This is going to be a hallucination. Now second scenario, they will be asking question like that, the voices are generating on my own head. खुद के दिमाग में से अंदर से आवाज आ रही है. अगर if the voices are coming from inside, if the voices are coming from inside, this is going to be the subjective space. This is going to be the subjective space, and now it has become what? It has become pseudo hallucination. It has become pseudo hallucination. You understand? Agar andar se kuch ho raha hai, that is going to be pseudo hallucination. What is the term that should be there, right? क्या होना चाहिए? होना क्या चाहिए? It should be occurring in the outer objective space, then only we call it hallucination. बाहर होना चाहिए, तुम्हारी विल के अगेंस्ट होना चाहिए, मतलब इट इज़ नॉट अंडर विलफुल कंट्रोल, विदाउट एनी स्टिमुलस, एंड इट विल बी विविड, मतलब देखोगे तो बिल्कुल रियल लगेगा. दैट इज व्हाट इज हेलुसिनेशन. अगर अंदर हो रहा है कुछ, दैट इज गोइंग टू बी सूडो हेलुसिनेशन. यू अंडरस्टैंड दिस? ओके, ग्रेट. Next question we are having, a 25-year-old male patient is having some sort of disorder characterized by after killing his victim. After killing his victim, he licks the wound of the victim, drink the blood and eat the flesh. Here, drink the blood and eat the flesh to gain the sexual pleasure. Which of the following is going to be best explaining this particular thing? Is it a necrophilia, or what is this klismaphilia, fetishism, or necrophagia? What do you think? Tell me, what is klismaphilia? Necrophilia, you already know, sex with the dead body. Necrophagia, eating the dead body. This is, I think, you must be knowing. What is this fetishism? When you are using inanimate object for sexual gratification, inanimate object for sexual gratification, this is going to be known as fetishism. For example, the person is using the undergarments of a female, okay, or maybe of a male, right? So that is going to be your fetishism. That is going to be your fetishism. What is the sclismaphilia? ini-cet, they have asked about this option. So when you are using enema, when you are using enema for sexual gratification, enema for sexual gratification, this is the option they have given you. Yes, this is going to be your klismaphilia. Klismaphilia, person is using enema. Yes. Yes, Arya, if the person is using the clothes or any object of a female for sexual gratification, that is going to be the fetishism. That is going to be the fetishism, right? So here, this person is doing what? This person is eating the flesh. This person is eating the flesh to gain the sexual pleasure. And this is going to be what? The answer is going to be what? The answer is going to be necrophagia. Necrophagia, right? So now we are having some sexual disorders, right? Sexual dysfunctional syndromes we are having. Let's just have a look through it, right? This is a table from your book, right? So we are having psychogenic, we are having organic. Psychogenic matlab problem lies in the brain. So we are having sexual disorders, like we are having hypoactive disorder. हाइपोएक्टिव मेल भी हो सकता है, हाइपो एक्टिव फीमेल भी हो सकती है. सेक्सुअल अवर्जन डिसऑर्डर, कुछ लोगों को अवर्शन होता है, राइट? सम पीपल आर हैविंग अराउजल डिसऑर्डर, दे आर नॉट एबल टू अराउज, मेल इज नॉट एबल टू अराउज, फीमेल इज नॉट एबल टू अराउज. One disease we always discuss is your male erectile disorder, right? Female arousal disorder, some females are numb females, they are not getting aroused very easily, right? We are having orgasmic disorders, like we are having female orgasmic disorders, we are having disorder from the male orgasm, right? We are having premature ejaculation, right? Premature ejaculation, and the treatment we have already discussed, that is going to be your SSRI, which is going to cause delayed ejaculation. Some people are having pain, this is going to be sexual pain disorder. People are having dyspareunia, or maybe vaginismus is there. Dyspareunia means pain during the sexual intercourse, right? Sexual and other sexual dysfunctions are also classified here. All of them are what? Psychogenic. They are not organic. That means specific disease is not there. Specific disease is not there. That is going to be your psychogenic cause. What about organic cause? Organic matlab kuch na kuch disease is already present. Like some people are having what? Diabetes. Those people who are having diabetes, they are having problem with the nerve, right? I teach you in the physiology section. Glucose जाके क्या करेगा? Glucose is a single molecule. It is going to destroy your nerves. Patient will be having problem, right? Patient will be having problem with the neuropathy, he will be having problem with the vessels, right? Blood is not able to go there, and this particular patient is going to have what? Problem with the sexual disturbances will be there, right? So substance abuse can happen. Those people who are taking certain substances, they are going to decrease the this particular thing, sexual dysfunction, right? That can cause sexual dysfunction, right? Sexual dysfunction due to general medical conditions, as I have explained you about the diabetes, right? It can be both psychogenic and organic, right? Some damages can be there, there are some deformities that can happen. So these are the things, right? Important ones, let me tell you the important ones. We are having gender identity disorders. Gender identity disorder means there are some people, there is a, like we are having a lot of sex transformation right now. Nowadays we are having lots of sex transformation. When a person who is like upbringing like till 20 or 25 years of age, and he will be thinking, he will always think like he is a female from inside, but the external genitalia is looking like a male. I've taught you in the full section of physio, right? So how these things are happening? There are going to be certain disorders, right? So what is going to happen, they will always think from inside is what is more important. I've told you the chromosomes are more important. If the chromosomes are XX or chromosomes are XY, till the time this Y is present, the person is going to become the male. agar Y hai kisi ke andar bhi, he is going to become a male, and every male person is going to be a male person, right? So what is going to happen in the male person, there are some features. If the person is male from inside and the external genitalia will be like female, I've told you everyone is destined to become a female. So external genitalia is looking like a female, inside the testes are present. So this person can do the gender transformation. They will always say that I am a male, I am a male person who is trapped inside the body of a female person. So these are your gender identity disorder, very very important, right? Apart from that, we are having like homosexuality, right? Sexual disorder, it is also a sexual it is also a sexual thing, right? Next one, we are having paraphilias, sexual identity difficulties. We have seen gender identity disorder, we are having homosexuality, lastly we are having paraphilias. Very very important, because it is also coming in the FMT section also, right? Right. Yes, excessive sexual desire, that is going to be nymphomaniac and satyriasis, right? You have already discussed about this, right? Next one, we are having this pedophilia. Pedophilia means a person who is loving the child. The pedophile is a person who is loving the child, that is going to be pedophilia. What is voyeurism? To see someone. Voyeurism matlab to see someone. Someone is changing their clothes, someone is bathing, if you are watching, someone is doing some intercourse and you are watching, that is going to be a voyeurism. That is going to be a voyeurism, and you can get the punishment if you are doing so, right? What is this exhibitionism? That is going to be to show, right? This particular person is showing the internal genital organs in front of people, that is going to be exhibiting something, right? Rape will be having this sadism. Rape, you already know what is rape. Sadism and masochism, two things are there. Sadism and masochism, those, the person who is giving the pain, the person who is giving the pain and getting the sexual gratification is known as sadistic person or sadism, right? So he is the person who is giving the pain, right? And the person who is love the suffering, that is known as masochism. He loved the suffering, that is going to be your masochism. Yes. Next one we are having is frotteurism. That means rubbing genital organs in public place or to someone, right? So if you are rubbing your genital organ to someone in a bus or in a train or something like that, touching the organs, that is going to be the frotteurism. That is going to be the frotteurism. Masochism, we have seen. Transvestism, that means changing the clothes, right? Wearing the clothes of a male person, wearing clothes of a female person, that is going to be your transvestism, right? This is your fetishism. We have already seen the fetishism, right? Fetishism. So these are the paraphilias that we are having. Paraphilias, from FMT or from psychiatry, definitely you will get some questions, right? You have to, yes, sadism matlab dena or masochism matlab lena, right? So that is the thing, right? Next question, we are having a 23-year-old male patient presented to OPD with the excessive sleepiness in the daytime. This person is sleeping in the daytime. He falls asleep when even when he's driving a long distance car, maybe during laughing, right? He's also had sometimes hearing of voices. He's hearing some voices while going to the sleep. Yes, what is the most likely diagnosis? I hope you will be able to answer this. I did not get your question, Puneet. Psychogenic means important with one woman and performing with other women. No, that is the lesbian thing, right? That is going to be lesbian. One woman with another woman is going to be lesbian. Yes. So that is going to be narcolepsy. The diagnosis in this particular case is going to be what? Narcolepsy. And this particular patient is having what? Sleep attacks. This particular patient is having what? Sleep attacks. Sleep attacks. What is happening? He's hearing certain voices while going to the sleep. This type of hallucination is known as what? This type of hallucination is known as hypnagogic hallucination. Hypnagogic hallucination. So you can remember, while going to the sleep, if someone is hearing voices, that is going to be the hypnagogic hallucination, and after coming from the sleep, that is going to be your hypnopompic type of hallucination. Hypnopompic type of hallucination after waking up. When the person is waking up, he will be having hypnopompic type of hallucination. When he's going to sleep, he's going to have hypnagogic type of hallucination. If I want to summarize this particular thing, narcolepsy hota kya hai, simple understanding if I want to give you, what is going to happen? You are having latency. If you understand this word, what is the latency of sleep? Latency of sleep matlab, you are going to the bed right now at 12 p.m. Right now what is happening? You are going to the bed, or let's say 11:30 तुम बेड को जा रहे हो, but still you are not able to sleep till 3 p.m. or 3 a.m. right? You are not able to sleep. So this is the latency of the sleep. This is the latency of the sleep. What happens in the narcolepsy? The latency of REM sleep is decreased. The latency of REM sleep is decreased, right? What you are doing after taking those sleep medications, what those sleep medications or benzodiazepines are doing, they are decreasing the latency of the sleep, right? That means अगर आप 12 बजे बेड को जा रहे हो and you are able to sleep at 3 p.m., what it is going to do? It is going to decrease the latency. It is going to decrease the latency. Now you are going to sleep at 1. ये कर रही है, right? So what is going to happen in the narcolepsy? The main problem is decrease in the latency of REM sleep. Decrease in the latency of REM sleep. So बंदा क्या होगा? बैठा बैठा, you must have seen in certain movies, बंदा बैठा है, पढ़ा रहा है, बात कर रहा है, बात करते करते सो गया. What happened? The latency of the REM sleep is decreased. अभी ज़्यादा टाइम नहीं लग रहा, सीधा नींद में चला गया. ड्राइव कर रहा है, ड्राइव करते करते is again going to the sleep. That is the latency basically decreased here in this particular case, right? What is the drug of choice in this narcolepsy? The drug of choice is what? Drug of choice we are giving is modafinil. We will tell the patient to take proper naps in the daytime. Okay, and what are the symptoms you have to remember? You can remember the mnemonic, that is going to be chess. C4, you can have cataplexy. Cataplexy मतलब खड़ा का खड़ा ही सो गया, right? The person is having cataplexy. H4, hallucination will be there. What kind of hallucination I have told you? Hallucination, hypnagogic hallucination, hypnopompic hallucination, right? Excessive sleep will be there. E for excessive sleep. Apart from that, next test is for the sleep paralysis. What is the sleep paralysis? You must have seen, you might have heard about this particular term. The person is sleeping, he wants to stand up, but he is not able to stand up. He wants to scream, वो चिल्ला रहा है, वो सोया हुआ है, but he is not able to move his body, right? That is what is sleep paralysis that we are having. And there will be sleep distortion. Obviously we are having sleep distortion, that is going to see in the cases of narcolepsy. Somnolence मतलब क्या होता है? जो अपन पढ़ाई करते हैं तब आता है. That is going to be your excessive sleeping. When you are studying, we are having excessive sleepiness, that is going to be your somnolence. But narcolepsy is a disease where you will be having what? Decrease in the latency of REM sleep, leading to what? Patient will be sleeping at anywhere, anytime, right? And we are encouraging those patients to take modafinil. Apart from that, yes, भूत भूत कुछ नहीं होता. That is nothing but भूत नहीं बैठा चेस्ट के ऊपर. You are not able to move, I know, but this is the thing. You are having what? You are having sleep paralysis, and now you cannot move. You may be thinking that पूरी तुम जो भगवान को याद करने कर लिया, but still you are not able to move. But the thing is, this particular thing, your body muscle tone is lost. You are not able to move because of that, right? Your mind is working, you are awake, you want to scream, but you cannot, right? So this is nothing but your sleep paralysis. It is a common thing, no need to worry about this, right? Next question we are having is, a 30-year-old female patient presented with episodes of mania along with the hypomania. Okay, and depression in the last 1 year. Now you give me your diagnosis. Okay, with complete recovery in between the episodes, which of the following can be used to treat this particular patient? What is the thing that can happen over here? So what is your diagnosis? This is a classical case of bipolar disorder. This is a classical case of bipolar disorder. In the cases of acute mania, the drug of choice you already know. I know everybody knows about this drug, but this drug has a narrow therapeutic index. Remember, lithium, definitely they are asking question, reason being it has a narrow therapeutic index. Narrow therapeutic index matlab kya ho gaya? For example, you are using paracetamol, right? Paracetamol you can take 5 to 6 tablets. It is not going to cause that much of side effect. Not Do not take 4 to more than 4, but still you can take 5 to 6. It is not going to cause the major side effect. But if you take lithium like that, that is going to cause the adverse side effect. And this is what is the drug which is known as the drug which is having narrow therapeutic index. That means you can use it under the TDM, therapeutic drug monitoring karna hoga, right? So that is what is going to you have to remember. So acute mania cases, we are going to give antipsychotic drug, and we can also give benzodiazepine. Apart from that, we can give lithium, but lithium you have to remember the values. That is going to be, in some books it is written 0.5 to 0.8 to 1 to 1.2. Okay, so you can remember like 0.8 to 1.2 milliequivalent per liter. So that is going to be the value that you should be remembering, right? For maintenance purpose, this is for the acute cases. Maintenance, you have to remember 0.5 to 0.8 milliequivalent per liter. That is going to be the dose you are going to use for the maintenance purpose. Next question they ask about the lithium, that is going to be from the side effect of lithium, and this is, you can remember with the help of the mnemonic. The mnemonic is lithium itself, right? So what it is going to do, it is going to increase the levels of leukocytes. So it can cause leukocytosis. That means leuko matlab white, cytosis means white cells will be increased. It can cause increase in the urination. It can cause polydipsia, increase in the thirst. That is going to be polydipsia. Polydipsia matlab thirst बढ़ा देगा, right? It can cause interaction with certain other drugs like NSAIDs. We are having NSAIDs, ACE inhibitor, diuretics. We are not we are avoiding them, right? It can cause nausea, vomiting, diarrhea, right? Muscle weakness it can also cause, and it can cause skin side effects like acne and psoriasis, right? We'll be discussing about psoriasis in the next session. We will be taking the derma, right? In pregnancy, what is going to happen? It is a teratogenic drug. Remember, it is a teratogenic drug, so we will be avoiding this particular drug in the cases of pregnancy. We will be avoiding this particular cases in the cases of pregnancy. The answer here in this particular scenario will be lithium, right? A 24-year-old male patient is sleeping in the NREM sleep. Now the patient is sleeping in the NREM sleep. Which of the following can be a feature of NREM sleep? Which of the following can be a feature of NREM sleep? So you have to remember what are all the REM and what are all the NREM sleep. So we are seeing the dreams in both the sleeps. सपने दोनों दोनों नींदों में आते हैं. बट द थिंग इज REM sleep the dreams which are coming वो हमें याद रहते हैं. You can remember rapid eye movement, the dreams will be remembered, right? Whereas NREM dreams you are not able to remember. NREM dreams you are not able to remember. You cannot continue your dream, but you cannot even remember them, right? So what is going to happen? The dreams that are coming in NREM sleep, they are known as night terrors. तो रात को बच्चा उठता है, रात को बच्चा सो रहा है, he will be waking and he will be like, I'm so afraid. What when you ask the content what was your dream, he's not able to recall. He's How he can recall? Because it is in the NREM sleep. So the dreams or the dreams which you are not able to recall, they are coming in the NREM sleep. These are known as what? Night terror. These are known as night terror. Whereas you always say this is the worst nightmare of my life. This is the worst nightmare of my life, because you can remember it, right? So nightmares are the dreams which are going to come under the REM sleep, right? Narcolepsy, I've told you, here you will be having decreased latency of REM sleep. That is going to be your narcolepsy. That is going to be your narcolepsy. So this is what we have already discussed. Apart from that, we are having sleepwalking. If you are walking in the sleep, घूमते घूमते कहीं चले गए पड़ोसी के घर, दैट इज गोइंग टू बी व्हाट, दैट इज गोइंग टू बी सोमनाम्बुलिज्म। एनआरईएम मतलब याद नहीं है तब तक ठीक है, अगर याद है तो दिक्कत हो जाएगा, राइट? सेकंड इज योर स्लीप टॉकिंग, यू आर टॉकिंग इन द स्लीप, यू विल बी लाइक कल देख लूंगा उसको, ऑल दोज थिंग्स दैट यू आर टॉकिंग इन द स्लीप, दोज पीपल हु आर लिविंग टुगेदर दे नो इट, right? So sleep talking is your somnolic disorder of NREM. Bruxism, some people are doing what, teeth clenching or teeth clenching or teeth grinding. This is known as bruxism. And lastly, we are having this nocturnal enuresis. That means these are the patients which are going to do urination in the bed. That is going to be a nocturnal enuresis. And the drug of choice for nocturnal enuresis, they ask you, the drug of choice will be desmopressin. Okay, it is going to increase the V2 receptor. V2 receptor is going to increase the water absorption from the lower part of the collecting duct. If you can recall, water will be getting reabsorbed in the body, less water will be going to the bladder, bladder will not get filled. If bladder will not get filled, there will be no urination in the night time. Drug of choice will be desmopressin. Treatment of choice, if they ask you, treatment of choice will be bed alarms. Okay, this is going to be bed alarms. Okay, next we are having so this much you have to remember. So all of the following are the REM sleep disorder. Which one is the feature of an REM? So try to answer. Nightmares are going to come in the REM sleep because you can remember them. Sleep paralysis and REM. Teeth grinding or teeth clenching or bruxism and REM. Narcolepsy is a feature of REM. So this is a question. This is a question which is having a wrong option. So you can remember this particular thing, teeth grinding. This particular teeth grinding is the best answer over here. It is going to be the thing we are going to have in the NREM sleep. We are going to have in the NREM sleep, right? What is the term used to describe the phenomena where a patient is responding to the question, how are you, by repeating the same sentence, how are you? So this is going to be the question, right? What you have to remember, there are two terms. One is your lalia, another one is your praxia. लेलिया और प्रैक्सिया. लेलिया मतलब क्या होता है? लेलिया मीन्स स्पीकिंग. कोप्रोलेलिया, कोप्रोप्रैक्सिया. What is the meaning of praxia? Praxia means simple movement. Movement will be there. Copro means bad, right? So coprolalia means inappropriate or bad sentences are spoken. Inappropriate sentences are spoken. That is going to be your coprolalia. Ecopraxia will be repetition of behavior. If I'm doing like that, everyone's the patient started doing like that, that is going to be repetition of behavior. Copropraxia, copro means bad. Okay, so it is going to be inappropriate gestures. The person the person will show you inappropriate gestures, or you can remember movements. Inappropriate gestures or movements will be there. And lastly, echolalia. Echolalia matlab repetition of same words or sentences. So you have to remember the two important things, the two terminology, and this question is done, right? You have to remember lalia means speaking and praxia means there will be some movements. So if you are asking someone how are you and he's repeating the same sentence, how are you, right? So this is going to be your echolalia. If you are doing like this and the person is also doing like this, this is going to be echopraxia, right? Now next question, what is the fear of height is known as? The fear of height is known as what? What is this acarophobia? What is this algophobia, agoraphobia, or acrophobia? Yes, acrophobia is mites, fear of mites, or maybe small insects that we are having. Fear of mites or small insect is known as acrophobia. Algo मतलब क्या होता है? That is going to be your pain. So here we are having fear of pain. Fear of pain. Agoraphobia, fear of places from where the escape is difficult. Fear of places from where जहाँ से escape is difficult, from where the escape is difficult. This type of places are known as, this type of fear is known as uh, agoraphobia. It can be a closed, you know, agoraphobia does not means just the closed spaces. It can be a big ground. It can be a big ground. It can be a lift as well, right? लिफ्ट में से भी जहां से भी निकलने में इशू हो, दैट इज गोइंग टू बी योर अगोराफोबिया. एक्रोफोबिया, फियर ऑफ हाइट. एक्रो मतलब तो एक्सट्रीमिटीज होता है, सो दैट इज गोइंग टू बी फियर ऑफ हाइट्स. Fear of heights is going to be acrophobia, right? Next question, all are the stages of grief or loss except. Whenever there is a person who's lost something, किसी को खो दिया, what are the stages that are going to be there apart from what is going to be the exception here? So you can remember that is going to be dabda. That is going to be dabda. That is going to be dabda. So first of all, you will be having denial. फर्स्ट ऑफ ऑल यू विल बी हैविंग डिनाइल. देन पहले तो तुम बोलोगे कि नहीं ऐसा नहीं हो सकता. देन देर विल बी एंगर. देन यू विल बी शोइंग द एंगर कि ऐसा क्यों किया, राइट. देन यू विल डू द बार्गेन कि प्लीज सब ठीक कर दो, राइट. एंड देन यू विल गो इन टू डिप्रेशन. एंड लास्टली यू विल बी हैविंग व्हाट, एक्सेप्टेंस. लास्ट में एक्सेप्ट कर ही लेते हैं. So with time everything will be okay. So lastly we are doing what, acceptance. So this is the stages of grief or loss, right? So what is not going to be included over here? Yes, that is going to be D. That is going to be, yes, that is going to be your agitation. That is going to be your agitation. Next question on the list, which drug among the options provided would assist the chronic smoker in the aim to quit the smoking? So which of the following is going to be the drug you are going to use for the smoking cessation? So first of all, you can remember this bupropion. You can use it or not? Yes, this bupropion. We are also having one more drug that is going to be buspirone. Buspirone, remember buspirone, ये रोने के काम में आती है. That is going to be anti-anxiety. This bupropion is going to be for the anti-smoking drug. This is going to be anti-smoking. It is going to decrease the craving. It is going to decrease the craving and also the withdrawal symptoms. Craving and withdrawal symptoms are going to get decreased. Okay. And what about this C, chronic smoker? Vernicillin. Remember this vernicillin we can also use. And the question they have asked, it is going to work on which receptor? So it is going to work on alpha 4 beta 2 receptor. These are going to be your nicotinic cholinergic receptor. Nicotinic cholinergic receptor. I have taught you in the detail what this cigarette is going to do to your body. When you are taking the cigarettes, what will happen to your body, we have discussed in the physiology section, right? So this is going to activate your nicotinic cholinergic receptor. Then your those organs which are connected with this parasympathetic nervous system is going to get activated and you will be feeling better, right? It is going to activate your dopamine and that dopamine is going to give you that particular kick, right? So this is what is happening. For the quitting of smoking cessation, we can use nicotine replacement therapy. Apart from that, we can use bupropion. We can also use vernicillin. These are the drugs we are having. So answer will be both A and C we can use for the cases of smoking cessation, right? We can also use for the cases of smoking cessation. जिसको छोड़नी है एक ही बार में छूटेगी, धीरे धीरे करके नहीं छोड़ना है, ठीक है? तो एक ही बार में छोड़ दो, खत्म हो जाएगा, right? Those people who want to quit, right? Next one, alcohol, we need to taper it down. Smoking, you just need to cut it off, right? A patient stopped alcohol consumption for 3 days and presented with irritability. Same story, 3 days से alcohol नहीं लिया है, right? Irritability, disorientation, paranoid delusions are there, agitation is there, visual hallucination is there, altered sensorium is there. I hope you get the answer, right? What is the likely diagnosis in this particular case? What is the likely diagnosis in this particular case, right? So 3 days, 72 hours, 72 hours you will be having symptoms of what? You will be having symptoms of delirium tremens. Delirium tremens. What is this Wernicke's encephalopathy? Remember, this is an acute neurological disorder. This is an acute neurological disorder. Here you will be having symptoms like patient will be having symptoms like nystagmus. Patient will be having symptoms like ataxia will be there, confusion will be there. And what is the main problem? What is the main problem that is happening because of this drinking? There will be decrease in the vitamin B1 or thiamine deficiency will be there. If you are not treating this Wernicke's encephalopathy, it can, untreated encephalopathy can convert into Wernicke's psychosis. And remember, psychosis is a disease. Untreated, it will be converting into Korsakoff psychosis, and it is a disease that we are having. You will be having confusion, right? For the treatment, I have already told you this is a alcohol thing. Yes, Goa will be there, global confusion will be there, right? Ophthalmoplegia will be there, ataxia will be there, right? So for the treatment, the drug you will be using is chlordiazepoxide. Chlordiazepoxide is the drug that we are using. We can also use drugs like lorazepam, right? So this is your Korsakoff psychosis, Wernicke's encephalopathy, that is going to involve your mammillary bodies, right? D. Clembert syndrome or fantasy lover syndrome, we have already seen the question with Alia, but right? Fantasy lover syndrome. So this cannot be the answer. The answer will be delirium tremens. Yes, very good. Next one we are having, which of the following drug abuse can lead to the symptoms described by a 25-year-old male patient who complains of sensation resembling insect crawling beneath the skin, and he is presented to the clinic? What is this symptom is characteristic with? Is it characteristic with cannabis, cocaine, amphetamine, or alcohol? So these are the insect which are crawling beneath the skin. This is also known as cocaine bug. These are also known as cocaine bug phenomena. This is also known as formication. The names are important. Formication. This is also known as Magnan phenomena. Magnan phenomenon. Right? This is seen with the cocaine. Remember, this cocaine is a vasoconstrictor thing, and I have told you, whenever there is vasoconstriction, there will be increase in the blood pressure. There will be increase in the blood pressure, decrease in the supply. What is going to happen? It is going to cause what? Hypertension. This cocaine can cause hypertension. Cocaine can cause hypertension. And this cocaine is also responsible, because of vasoconstriction, it is also responsible for the there will be nasal septal perforation. It is going to clog the vessel. Nasal septal perforation. Those people who are snorting the cocaine, what can happen? Nasal septal perforation. And because of this vasoconstriction, one more specific thing, jet black pigmentation of tongue. Jet black pigmentation of tongue. Jet black pigmentation of tongue can also be seen. Remember, this cannabis is going to inhibit your CNS. This alcohol is also going to inhibit your CNS. It is going to depress your CNS, right? Whereas this amphetamine is a stimulatory thing. Amphetamine is going to be a stimulatory thing, and cocaine is also going to stimulate, right? What about smoking? Smoking is going to increase your acetylcholine. That is also going to be stimulatory, right? Some people are taking alcohol with smoking, right? Smoking is a stimulatory thing, alcohol is a depressant thing. You are doing the wrong thing, right? Next thing, in which of the following condition is labile indifference is observed? You should not take both of the things. You should not take both the things, right? In which condition is labile indifference is observed? What is this labile indifference, and when do you find this? Labile indifference. Yes, those people who are having, like for example, some people get the news that they are smoking for such a long time and right now they are having cancer, right? So what will happen? There will be inhibition, or you can say absence of psychological distress. This is a type of conversion disorder. So there will be absence of psychological distress in spite of having serious disorder. ये लोग भूल जाते हैं. These are the people who, they are like, they will come to you and they will be normal, they will feel normal and they will tell you that I'm having cancer and it's completely fine. So that is going to be a conversion disorder that we are going to see. This is known as labile indifference. Okay, panic disorder we have discussed, schizophrenia we have discussed, depression we have discussed, right? What non-pharmacological measures can be recommended to a middle-aged man who experiences premature ejaculation during intercourse? So, are you going to give CBT? Remember, the CBT we are going to give for the cases of anxiety and depression. For phobia, I've told you that is going to be BT, right? Here, for anxiety and depression, we are going to give cognitive behavioral therapy. This one, exposure and response prevention, we are going to give in the cases of obsessive compulsive disorders, right? Obsession is there, obsession is there, and compulsion is there, right? Next one, we are having squeeze technique and we are having sensate focus therapy. This sensate focus therapy they have given in the examination. What is this? So this is a form of sex therapy. Here they are going to do increase the, basically these are the exercises to increase the sexual communication. Right? They are the exercise which are going to increase the sexual communication, and they will be decreasing the performance anxiety. So male and female partner are doing what? They are coming together and they are performing certain exercises to increase the communication, and that will lead to decrease in the anxiety. That is what is happening, performance anxiety, right? During the intercourse, if they are asking during the intercourse, then your answer will be what? Squeeze technique. You are doing the squeeze technique, and due to squeeze technique, what will happen? There will be delayment in the ejaculation, right? So that is what is uh, the answer for the treatment of premature ejaculation, right? So the answer will be C in this particular case. What is the term used to describe the therapist's feeling towards the patient, which can be both conscious and unconscious, and can be both negative as well as positive? Without, right? We are having transference, we are having counter transference, we are having empathy, projection is there. Okay, so what is this transference? ट्रांसफरेंस मतलब क्या हुआ? एक पेशेंट आया, पेशेंट इज कमिंग टू अस एंड वॉट एवर द फीलिंग ऑफ पेशेंट, whatever is the feeling of patient towards the doctor, feeling of patient towards the doctor is known as what? Towards the clinician or doctor is known as what? Transference. जो patient feel कर रहा है about the doctor, that is going to be the transference. Counter transference मतलब now our doctor is feeling what about the patient, be it your good thing, be it your negative thing, positive things. So this is going to be feeling of clinician or therapist, feeling of therapist or doctor towards the patient, that is going to be counter transference. Right? What is this empathy? Empathy is ability of a therapist, ability of a doctor to understand and share the feeling of a patient, to understand and share the feeling of a doctor, share the feeling of the patient, share the feeling of patient. This is going to be your empathy. And projection, remember projection is a different entity. It is we will be discussing in the defense mechanism. We have discussed in the defense mechanism. So defense में क्या होता है? For example, पापा ने तुम्हें मार दिया. Now what you will do? You cannot throw back to the father, right? What you will be doing? तुम छोटे भाई को जाके मार रहे हो, right? So this is going to be a thought projection. Be it your thought, be it anything. So that is going to be projection. तुमने किसी का गुस्सा किसी पे निकाल दिया. That is going to be your projection. That is going to be your projection, which is a type of yes, which is a type of defense mechanism, right? So this is what is it is, right? Next question: which of the following fact about the structural theory of mind is incorrect? The id operates the on the pleasure principle and lacks impulse control. So let me make you understand. We are having three minds, तीन दिमाग होते हैं. Basically we are having subconscious, we are having conscious mind. Conscious में क्या है? जो भी कुछ you are thinking, whatever things you can think, whatever things you can do, these are in your conscious mind. You can always go back to your subconscious. We are having techniques for that. Yes, in subconscious minds, those things which are not necessary, which are not like you should be thinking about, those things will be going under subconscious mind. So this is the first thing. Second thing, we are having three things here. One is your ego, another one is your id, and third one is your super ego. So how these things are going to function? So it is based on the pleasure principle. जैसे अभी तुम क्लास में पढ़ रहे हो, right? And what you will be thinking, like कब खत्म होगा, बंद कर देता हूँ, कुछ और कर लेता हूँ. Let's do something uh, which is going to give you happiness. Let's see some reels or just talk to someone, right? So this is the id principle that is going to give you pleasure. It is always going to work on the pleasure principle. जो जिन चीज़ों में मज़ा आता है ये उसकी तरफ भागेगा. Second one, we are having ego, and third one is your super ego. Super ego is going to be responsible for all the things. ये सारी अच्छी चीज़ें कराएगा, all the good things. ये बोलेगा 6 बजे उठना है, 12 बजे सोना है, बीच में फ़ोन नहीं चलाना. All these things you should not do. You should always do study. So this is going to be on the higher side always, right? And what is this ego is doing? Ego is something that is balancing between id and super ego. Now you are balancing the things, and what you are balancing? Okay, let's do this session. Let's do this session, and after this I will have a good dinner, और आई विल टॉक टू माई फ्रेंड, आई विल टॉक टू समवन. तो ये ईगो है जो बिटवीन में है, राइट? सम पीपल आर हैविंग ओवर एक्टिविटी ऑफ द इड, वो लोग गलत चीज़ों में पड़ जाते हैं, राइट? सम पीपल आर हैविंग ओवर एक्टिविटी ऑफ द सुपर ईगो, दैट इज ऑल्सो लीडिंग टू सम टाइप ऑफ पर्सनैलिटी डिसऑर्डर, परफेक्शनिज्म में पड़ जाते हैं, राइट? सो वी हैव टू बी इन बिटवीन. दैट इज द ईगो पार्ट, दैट इज द ईगो पार्ट, राइट? Now what do you need to understand? What is the incorrect statement that is given over here? The id operates on the pleasure principle and lacks impulse control. Is it a true statement? Yes, it is a true statement. It is working on the pleasure principle. The ego is the executive organ of the mind and balances the demands of the id and superego. Yes, it is going to balance between both the things. So it is also a true statement. The superego develops between 5 to 6 years of age and is mostly present in the conscious part of our mind. No. All these things are going to be in the subconscious part of our mind. So this is going to be a false statement. The structural theory of mind consists of id, ego, and superego representing different aspects of the mind. Yes, it is a true statement, right? So all these three are the true statement. The false statement that we are having is the option number C, and this is going to be the answer. Now we are having the last question. The last question is, which of the following statement about the given image about the image shown below is going to get incorrect? Yes. So what is this type of test? Have you seen these images? If you have ever been to psychiatry department, you must have seen this, right? The image is one of the card used in Rorschach's test. Yes, it is the name of the test is what? Ink blot or Rorschach's test, right? The description of the image is objective. let me make you understand how we are doing this. So when a patient is coming to us, and we want to assess the condition of the brain of the patient, what we are giving, we are giving such images to the patient, and these are the images the patient will be seeing, and we will ask the patient, what do you see? Now the patient will tell, I'll see a butterfly, and some people will see some monsters, right? So this is how we will differentiate the condition of the brain of a patient, right? What the patient is perceiving is totally different, right? Different person will perceive different things, the test will be similar, right? So they will be, some people are seeing the butterfly, some people are seeing monster. So this is what is going to differentiate the stage of the mind, the state of the mind of that particular person at that particular time, right? So description of this image is going to be objective? No, it is not going to be objective, it is going to be subjective. That means every person has its own imagination around this, right? If I ask you like 50 like all of you, if I ask you, everyone will think different about it, right? So this is going to be a subjective test rather than an objective test, right? So this is a false statement, and this is going to be the answer. Let's see the option number C. The image are typically symmetrical and ambiguous. Yes, they are typically symmetrical and ambiguous, right? The test involve asking individuals to interpret what they see in the images. Yes, this is what we are going to do. This is the Rorschach's test that we are having, using that we are using over here, right? So the answer here in this particular question is going to be B. Okay, so we are done with the session, and thank you so much for all your patience. And the last quote that we are having, a river cut through a rock not because of its power but because of its persistence. Keep doing your hard work. You are at the last phase of your cycle that you are doing, right? This is the last time. You will be soon coming on the other side of the fence. So just do whatever you are doing. Feeling difficulty, always you can reach out to us. My These are my Instagram and Telegram. You can always reach out to me. The PDF I will be sharing here in this particular Telegram group. You can join that, right? Yes, most of the things I have tried to cover. If you are finding difficulties, if you find some specific topics, we are also having another video. You can always go through that. It is covering more, it is of more time, right? So you can do that. Okay. Good night. Take care. If you have any doubts, you can ask me on Instagram or on Telegram, right?